So let's have Tatekwashi Memorial Hospital. Paragraph 638. Kindly introduce yourself to the committee. Well, okay. The front is empty. Can we have the minister, the chief director?
My name is Dr. Albert Bene, the medical director at Tatekwashi Memorial Hospital.
Honorable Chair, I'm Joseph Bayo, internal auditor.
Honorable Chair, I'm Kenneth Avejida, Head of Finance.
Honorable Chair,
Thank you very much. You're welcome. You have only one issue, paragraph 635. On earned salary. No. Paragraph 638. Payment of unearned salary. 108,436 Ghana cedis, which was paid to 15 staff between November 2021 and April 2023. The auditors recommended to the medical director to ensure that the recovery of the amount is made from the 15 officers. Have you recovered the money from them?
Thank you, Honorable Chair. We have started the recovery of the amount. Out of the 15 so far, we've been able to recover 3 of them. We have written to the NIB, which they have started making the recovery for us. Some have gone there and paid, but they gave them receipts because they've not been able to complete such payment. We have such receipts with us, but the auditors say they want a complete payment before it will be accepted. And then there is one staff who was also on leave, and one of the months that he was charged. We have the evidence here, and the staff did not actually collect such money. This morning, whilst we were coming in, we also received a copy of such document from NIB, from one of our staff. We also have it here. We will submit to the auditors. So we are in the process of recovering. Can we say?
But where were your officers, those in charge of the human resource department? Where did they validate these nurses? Because I went through, virtually all of them are nurses who have vacated posts. Some are on leave without pay, but were paid. And so why should they validate them, knowing very well that they have vacated posts?
Thank you. Sometimes when they go on leave and they don't return, we send letters to their banks.
Yeah.
But the banks, some of the banks still allow them to take the monies. So by the time we get to know, they have already taken. So it's usually 1 month, 2 months. So it's not something that one person really has gone on to collect so much. And then there are some who also go to school and then they vacate. So that's why we have some of
Yeah,
these.
especially those that are more than 1 month. If it's 1 month, that one is understandable, that by the time the information gets to you, they would have been paid. So we can accept those ones and ask you to work on them. But if the person is paid for 21,000, 10,000, 11,000, it means that the person received not less than 3-4 months. That is why we have an issue. So the validator who did the validation must respond to this. Do you have your HR director here?
Unfortunately, we don't have the HR director here.
Is she the one who validates?
Yes, he and then the health service administrator, they are the ones who validate.
They validate. So they did the validation wrongly. So you have recovered from only three of them?
Actually, it's more, as I said.
Okay.
But because NIB, they are not willing to give us because they have not finished paying. So they said they will not release that to us. And the ones we gave to the auditors, they are also not ready to accept it because it's not complete. But
The auditors, when they can have a look at it
so the ones,
to update their record.
yes, please.
So when we finish, you can give it to them. They will verify and update the record. So we are asking you to pursue the matter seriously to recover the money.
Yes, sir.
All right, that will be all for you. Cape Coast Metro. Paragraph 603. Honorable Sampson.
Cape Coast Metro, are you here? No. Huh? They're not here. They are not here. Hello. Mr. Chairman, this infraction has to do with a payment not fully substantiated. And the amount is 22,146. Your recommendation was that the medical superintendent should recover the amount of 22,165, 145.70 from the accountant and pay same into the Auditor General Recovery Account at Bank of Ghana. Has this been done?
Honorable Chair, the amount has been fully retired.
Auditors, can you confirm this?
Honorable Chair, confirmed.
Thank you.
All right, the next one is paragraph 606. Honorable Johnson.
Thank you, Chairman. Your infraction has to do with unremitted withholding tax. And the amount involved is 16,981. Can you tell us the status now?
Honorable Chair, all the taxes have been remitted.
Chairman, all the withholding taxes have been remitted. Auditors, please, can you confirm?
The outstanding taxes have since been remitted. Thank you.
Chairman, we are good to go.
Next one, paragraph 609. Vice Chairman.
Thank you very much, Mr. Chairman. We are talking about unpresented payment vouchers, totaling 48,351. And what has happened to it?
Honorable Chair, the PVs were retrieved and submitted to the auditors. 18 of them.
Auditors, could you confirm, please?
Honorable Chair, they've presented the PVs now.
That'll be all for Cape Coast Metro. Elmina Polyclinic, paragraph 587. Honorable Chinia. Honorable J. Watson, can you take it? 587.
Thank you, Chairman. Elmina Polyclinic, unremitted tier 2 contribution amounting to 14,108. Can we be told that it's been done?
Honorable Chair, has been done. The monies have been paid to enterprise fund.
Auditors, can you confirm for us?
Honorable Chair, confirmed.
Chairman, that will be all.
Thank you. Paragraph 565, Gomoa Osije Health Center. It's on unpresented payment vouchers, 7,444. Recommendation is to recover the amount from the physician assistant in charge. Has the recovery been made?
Honorable Chair, an amount of 3,126 has been recovered, and 1 PV was retrieved and also submitted to the auditors.
Auditors, can you confirm?
Honorable Chair, we can confirm the amount of 3,126. The PV we were told, but we are yet to see the PV.
Okay, so you liaise with your auditors in the district to verify that and confirm.
One note, Chairman.
Paragraph 568, Gomoa Obuasi Health Center. Honorable Isaac.
Thank you, Chairman. 568 is locked up funds. The records indicated that the health center for a period had a balance of 5,257 in the accounts of Achampim Community Bank at Gomoa, the Urampong, but had been unable to access the funds due to liquidity problems. The recommendation is that the district officer of the health services should report to the Regional Health Directorate to liaise with ARB Apex Bank to recover the funds. Has the amount been recovered?
Honorable Chair, the amount has not been recovered, but the implementation has been implemented. The recommendation has been implemented. The district actually wrote to the region, and the region wrote to the ARB Apex Bank to assist to recover the money, but it hasn't been recovered.
Have you received any response from the bank?
Not yet, but now that headquarters will follow up since.
Is that okay? Auditors, are you aware of the efforts made so far by Gomoa Obuasi?
Honorable Chair, efforts are being made, but the money is still not recovered. Thank you.
But you have evidence of the efforts. So I think I'll urge you to continue to pursue, the recovery. If you have to do a follow-up to the Regional Health Directorate, please do.
Noted, Honorable Chair.
Chairman, you are making all the efforts, so I think we can. It's part of the locked-up funds.
Paragraph 572, Gomoa Nyanyano Health Center. Unremitted tier 2 pension, 2,120. Has the amount been remitted? Has the fund manager identified and money remitted?
Honorable Chair, the fund manager has been identified. The staff have also been registered, the casual staff, but we are yet to get a code to be able to pay. So it's partially implemented.
Who gives the code?
I think Enterprise Trust will give the code.
And all this while they have not given the code. So the subsequent deductions, where are they being kept?
So when they deduct, but it's in the account. Then when they get the code, then they pay everything.
So can they do a follow-up?
Okay,
The head office should help them. These are small entities.
Okay.
Head office should help them for them to get a code.
Noted, sir.
Gomoa Porcine Polyclinic. Honorable Ennis.
Thank you, Mr. Chairman. This is on end salaries for two, one, Ms. Rosemond Adair, a principal nurse who vacated her post sometime in April 2021, but was validated. Hers is 36,350, and the other person, Ms. Rita Akia Edu, also a senior staff midwife, who also failed to report after her 36 days annual leave. She was validated and paid for 3,821. Have you been able to recover the amount of 40,172?
Chair, we have recovered 3,274.83 in respect of Rita Equia Edu. But that of Rosemond Adair, we are still pursuing her to get that recovered. So that is not recovered.
What steps have you taken?
We wrote to her. We've contacted her husband, who has promised to ensure that they pay, because she is not in the jurisdiction.
Auditors, can you confirm the recovery of 3,600 for Rita Equia Edu?
Honorable Chair, it's 3,274.
3,274. Can you confirm that?
Honorable Chair, an amount of 3,274.83 has been recovered from Rita Edu. The other person own is still pending.
Okay, Mr. Chairman, so for Madame Rosemond Adair, they are unable to recover any amount because her husband has not been able to pay. So I will yield to you on what to do next.
Okay. I think that the ministry and the Ghana Education Health Service, you have a lot to do in terms of this and nurses traveling outside the country. It's a big challenge that you need to work on. Yes. You need to work on that. It's very important. All right. Let's have Achimota Hospital, paragraph 412. Honorable Chinia. Okay. 412. It's unsupported payment, 55,578. A number of PVs are involved. You have to recover the money from the head of finance. Medical Soup hasn't been able to do that.
Honorable Chair, all the payments have been supported and provided to the auditors.
Auditors, can you confirm?
Honorable Chair, the necessary supporting documents have been provided. Thank you.
Then paragraph 415, unapproved payment of motivation allowance. Director General, you see, all the hospitals are developing new things on their own. They'll begin to pay amounts. If it's not checked, in future, it will create problem for government. It will create problem for government, big time. So it should be checked now. There should be a policy position on this.
We will work also with the ministry to ensure that probably maybe something that's brewing the entire sector to see how we can curtail. I say we have reviewed and agreed on what is payable, and then we have submitted it to finance. But I think we can do more to curtail any new ones popping up.
Yes. And in this case, the total amount involved is 3.6 million to a number of staff involved. So the The amount actually is 525,734.69 to staff of selected department of the hospital, which collected a total revenue of 3.7 million. This revenue sharing arrangement was carried out without approval from the Ministry of Finance. So as I said, we should come up with a position before it is too late. Paragraph 419, Honorable Ajay Boateng.
Thank you, Chairman. 419 is unrecovered staff advance. And you advanced 23,200 to 4 staff members between January 2021 and December 2022. The recovery rate was only 2,300, leaving a balance of 20,900. Management said they were collecting. Have we been able to recover those monies?
Honorable Chair, yes, we've recovered 17,200, then leaving a balance of 3,700. But as at Friday, with our reconciliation with the auditors, it was 8,200 that had been recovered. But on Monday, yes, that was yesterday, an additional 9,000 was paid, so 17,200 is what has been recovered. But the auditors have 8,200, so we'll reconcile that with them.
Auditors, can you confirm the figures for us?
Honorable Chair, as he rightly said, earlier when we had 8,200, but subsequently we were informed of an additional recovery, who sums up to 17,200, leaving a balance of 3,700.
Chairman, they have 3,000 to fulfill the entire amount.
Last one for Achimota. Paragraph 423 is rent defaulters. Occupants of 25 bungalows owe the hospital a total of 29,818. Have we recovered the money from them?
Honorable Chair, 7,338 has been recovered. We still have 22,580 to recover.
Are they paying? How are they paying the money?
Now we have actually mechanized the rent payment. So this has to do with the arrears before the mechanization, and they are paying.
Now they are paying based on the mechanization.
Based on the mechanization.
I'm talking about how are they paying the recovery, the arrears?
So they have we have payment plans with them to pay. And actually, today we had an update that 15,125, so an additional 7,000 plus was paid between Friday and then yesterday. But that the auditors don't have that information. But I have the schedule here for each one.
Okay, we will ask you to ask the hospital to continue to recover from the occupants, but we are giving them 2 months to be able to mobilize funds and recover and pay the money. Some of them owe very little, which is not much, so 2 months they should be able to pay.
Thank you, Chair.
Now, paragraph 425. I think this issue came before us before, or that some of the occupants who retire are still occupying the bungalow, flat number 3, while 3 officers who were transferred between 2014 and 2018 continue to occupy the hospital bungalows. So the recommendation is that auditors are saying that the retired and transfer staff should, as a matter of urgency, be ejected from the buildings. Now, the management response is that you have actually responded to only the deductions, which have been mechanized. Are those 3 retirees or transfer people still occupying the bungalows?
Honorable Chair, I know one of them who I think is still in active service. That's Mr. Nsobila Atindana.
Okay.
But the other 2, I don't know them. So those may be, I don't know whether, I don't know. We don't have much information, but we can follow up.
Do we have Achimota here? Achimota, are you here? And do you have more information to give us? They're not here. The ministry should, the Ghana Service should do a follow-up and get an update on this matter. Mamprobi Hospital, paragraph 428, Honorable Amakwata.
Thank you, Honorable Chairman. Mamprobi Hospital, the infraction has to do with unaccounted revenue amounting to 355,194 cedis. The facts are that the auditors found out that between January 2022 and June 2023, 2 finance officers, Victor Togbo and Hope Dejo, collected an amount of 2.6 million, but failed to deposit the exact amount. Rather, they deposited 2.1, leaving a balance of 480,193 cedis 56 pesos. However, portion has been paid out, leaving a balance of 355,193. What is the situation now? Has the outstanding balance been recovered?
Yeah, thank you, Chair. This is a situation that we actually found out and handed them over to the police before the auditing came up. So they had paid an initial amount once we caught them. We did investigations, and the recommendation was that they should refund the money with interest, and we also assigned to places, demoted, and also said that they should never head any finance area in the service again. We are still waiting. The matter is still with the police. We are hoping that we asked them, we found a region that the amount they are paying every month is a bit too small, so we're renegotiating to get a better payment plan for them to pay. For a while, they were on interdiction, and so it was after the interdiction that the demotion was effected.
I'm happy you complied with the directive from the auditors so that they should pay the amount with interest. I will encourage you, Director General, to continue to make sure that we recover the amount. Thank you. Chairman.
Dansuma Polyclinic, Honorable Samson, paragraph 432.
Thank you, Mr. Chair. Unaccounted drugs, 672,000.
you were asked to, the principal medical officer should ensure that you recover the amount. What is the status of this infraction?
Honorable Chair, the drugs were actually dispensed to patients at the dispensary, but the records were done in an electronic system which was being implemented at the time of the audit. And so since then, the printouts have been made and submitted to the auditors, which gives the details of how the drugs were dispensed, the time, the date, the patient's details, and the medications.
Auditors, are you satisfied with the explanation?
Honorable Chair, we've had the documents and reviewed them, and we can say that the drugs have been accounted for.
Nima Government Clinic, paragraph 435, Honorable Johnson.
Thank you, Chairman. This has to do with unserved bond. Here, one Equia Echa with staff ID so was granted study leave with pay to pursue a 2-year diploma in registered midwifery program at the Pantine Training College, Nursing Training College. She served for a period of 1 year from September 2020 to August 2021 and vacated posts. Therefore, she failed to serve her bond term of 3 years, leading to unserved bond amount of 30,397.74 based on salary she enjoyed during the study leave. Additionally, she was paid on earned salary of 14,687, making a total of 45,084 Ghana cedi.77. Medical Soup was asked to recover this amount from Equia Echa. Please, has the money been refunded?
Honorable Chair, the money has not been refunded. Unfortunately, the officer is out of the jurisdiction. We made all efforts to reach her. Management was not successful. So a report has been made to Interpol to assist us to locate her and recover the money.
Was she married?
Honorable Chair, we don't have that information, but we can get it.
I'm asking this because probably you could reach out to the husband to know her whereabouts, or probably been able to pay the money for her wife. That is why I asked. So do you have the Interpol reports?
Yes, we have the report we made to Interpol.
You submitted to the auditors for verification?
No, that has not been done yet, but we will do that.
Chairman, the position here is that the lady is outside the country and they have sent an Interpol, but they don't have the report with the auditors yet. So that is the status of the issue. Thank you.
All right, the next infraction is on paragraph 441 and is payment of unapproved allowances. We are here again, and the amount is 62,881. But the allowances were for phone credit, TNT, monthly lunch to prescribers, fuel, and transport allowances. I guess maybe you are going to look into that one also, right? Please, this is an issue, just like the chairman also said, it can get out of hand. The next paragraph is on, infraction is on paragraph 446, payment of salary to unknown persons. Honorable Afifa.
Chairman, thank you very much. Payment of salaries to unknown persons, 837,931 Ghana cedis. So the auditors, according to them, the payroll records, including electronic salary payment vouchers, disclose that between June 2022 and December 2022, 16 persons who had never been employees of the clinic, never, and ineligible to receive salaries were validated by management of the clinic and pay a total salary of 267,863 cedis, 71 pesos. Their further checks revealed that these unknown persons remain on the payroll as at 31st December 2023, resulting in an unearned salary of 837,930 cedis, 56 Ghana cedi pesos, as detailed below. Okay. The auditors recommended that the regional director, health director, should recover the total amount of 837,930.56 pesos from the medical superintendent and the validators with interest at the prevailing Bank of Ghana rate, and same pay into the Auditor General's recovery account at Bank of Ghana, failing which the sanctions under Section 96 should apply. Chairman, I want to find out what is the status of the recommendation.
Yeah, thank you, Chair. I want to explain the situation. They are really known staff. Over some time ago, probably not now, we had the HRIMS is for the Public Service Commission, where they create vacancies. So if you don't have vacancies, then they are put somewhere else. So these people were working at the facility, but their names were at the DHMT, that's the same district. So even though they work there, their names are in the district, but at the district health administration, not in the facility. So if you look at that record, that's what you think. So far, the system has been opened. They've created vacancy in these places. I think so far about 12 out of the 16 have been moved into the NEMA polyclinic payroll, and as vacancies are created, that issue will be corrected. And it was a nationwide problem, but now a lot of them has been done. The vacancies are being created so that we can move people to where they are really working and not put them somewhere so that they can receive pay whilst they're working. But this one was in the same district that they were working. It was one of the new districts, and so they still had creation of those payrolls where them was challenging, but now they are correcting them.
Chairman, can I continue?
Auditors, could you confirm what they just said?
No, Chairman, I wanted to ask another question before.
Okay, go ahead.
Their management response is, according to the auditors, they responded that it had taken notice of they have written to Controller Accountant General to delete the names from the clinic ESPV. I think there is differences in what the Director General is saying and what the responses they also gave at the facility. Thank you.
Thank you, Chair. I think there are. Sometimes some of the responses that are given, I would say they are ridiculous, and so we're making a recommendation that some of these management reports, if the region could also be copied, at least we'll know the real answers. Some of them down there may not even know what the situation is, and they give a response. So that's the challenge. But what I'm telling you is exactly what it is, that they are on payroll, but they are placed somewhere because there's no vacancy where they are supposed to be working.
I wanted to also find out, do you have internal control measures at the hospitals? Because you look as if some of the infractions that keeps on coming means that there isn't any internal controls within all the auditors. When you visit such facilities, do you see anything like internal controls are in place? Thank you.
Chair, if I can just, they've audited nearly 8,000 facilities in Ghana Health Service. We have 134 infractions. So one cannot say there are no internal controls in the system. There are human errors, and we think we can continue to work on them. Thank you.
Director General, what I would say is this. You see, this report is worldwide. So anybody could look at this report, and the headline is, you have paid 837,000 cedis to unknown people. Now, you have officers out there. When they got the audit report, and they had the management letter, they should have reacted a little bit to it. Otherwise, this wouldn't be here. So now somebody who doesn't have the benefit to come and sit here and listen to this, you have paid 837,000 to unknown people. But that could not be the case. Auditors, could you let...
Chairman, it's important. No, the auditors, before the auditors. I'm not stopping.
Auditors, could you confirm what he just said?
Yes, Honorable Chair, our follow-up indicated that indeed these are known staff. At the time they were on the payroll, but they could not provide the explanation to us that they are actually staff that were working at the DHD. But subsequently, they provided that information. And then we also reviewed the ESPV. And we can say that 12 out of the 16 have been deleted from the ESPV. So remaining 4 to be moved to...
All right, thank you. The next infraction is on paragraph 453, and Dr. Kisi will take that.
Thank you, Chairman. This has to do with unpresented general counterfeit receipt books, and the amount involved is 10,109 Ghana cedis. Please, what's the update on this?
Yeah, Honorable Chair, the GCR books actually could not be found. But when we got this report, we did further checks, and we actually confirmed that the books were used. So the serial numbers of these 2 GCRs have been accounted for in revenue collection books in the facility, which has been traced to the summary cash book and to the bank. And we have given this information to the auditors.
Audit Service, can you confirm this, please?
Honorable Chair, confirmed.
All
Chairman,
right,
that's it.
Thank you. The next infraction is on paragraph 457, and Honorable Frida will take that one.
Thank you, Chairman. Chairman, this has got to do with unsubstantiated payments. The auditors noted that 35 payments amounting to 34,995.21 were not adequately supported with valid and relevant document evidence or documentary evidence. The auditors therefore recommended that the medical superintendent should recover the amount of 34,995.21 from the head of finance and same paid into the Auditor General's recoveries account at Bank of Ghana, failing which the medical superintendent should pay. Have you recovered the said amount?
Honorable Chair, the full amount has been duly retired.
Can the auditors confirm?
Honorable Chair, documents were provided to substantiate the amount.
Thank you, Chairman. That will.
All right, the next infraction is on paragraph 460. And Honorable Sampson will take care of that.
Thank you, Mr. Chair. Not different from the previous one. This is just unpresented payment vouchers, 30,047. What is the status?
Honorable Chair, 7,859 Ghana cedis, 40 pesos, representing 4 PVs, have been paid into the Auditor General's account. 8 PVs were recovered, retrieved, and submitted to the auditors to substantiate the payments. Thank you.
Honorable Chair, confirmed.
Okay, thank you very much. That will be all for NEMA Government Clinic. What about Osu Government Maternity Clinic? Are you ready to answer those questions?
Yes, Honorable Chair, it has to do with one of those allowances which we written to the Ministry of Finance to get approval.
And the motivation allowance?
No, this is a drug and therapeutic committee allowance.
Without approval?
Yes.
So when are you anticipating you are going to get this approval?
We are going to follow up on it with the Ministry of Finance. And I'm sure with what has or is transpiring here, maybe it will be given the necessary attention by the authorities.
The next infraction, NMTC Kolebu. And Honorable Frida will take care of that one. Eh? You've done that? Oh, okay. That was when I stepped out. Oh, you already done that one. Okay. Osu government is done. Okay.
Lejokuku.
All right, Lejokuku 490. Okay. That is unaccounted payment. 11,290. Yes, sir. Any response to that one?
No, which the amount has been fully retired.
Auditors, could you confirm, please?
Honorable Chair, we can confirm that 400 CDs has been accounted for. They have actually indicated to us that the rest has also been accounted for, but they are yet to provide the documents to us.
Okay, all right. The next infraction is on Tema General Hospital, paragraph 493, private insurance indebtedness, 169,000 and some change. What is the status of this?
The hospital has been able to collect all the monies from these companies. That's 169,434 Ghana cedis.
Okay. Auditors, could you confirm, please?
Honorable Chair, we can confirm 158,642.94 with 10,791.06 remaining.
Director, what about the difference?
Honorable Chair, the records we have, all the amount has been recovered, so we will reconcile with them.
Please do, because
thank
it's
you.
really important on that one. The next one is on Pong Kantamanso, Municipal Health Directorate. Paragraph 497. Honorable Isaac. Yeah, it's on earned salary, 497.
Thank you, Chairman. Pong Katamanso 497 on earned salary. The auditors noted that Miss Victoria Na Ashokain Norte, a senior physician assistant who vacated post, was validated and paid an amount of 3,902 Ghana cedis. The recommendation is to recover the said amount. Has it been recovered?
Honorable Chair, the money has not been recovered yet.
Any reason?
The officer is out of the country, and reaching her is a challenge.
So do you intend to report to Yoko?
Honorable Chair, definitely we will report to Yoko.
Why has it taken so long?
They actually tried. We tried with a bank. So we first wrote to the bank, her bankers, and that took some time. But they wrote back that the balance they had in the account, they've also
It's not
used it
enough.
to offset a loan which the officer had with them. So we are now moving the next step. To
So
go to
you
the
have not been able to establish contact with her at all?
No.
Or the amount isn't, that's
Something small, yeah.
why that big. So I'm sure somebody who is working outside the country, it should be, relatively easy for the one to settle. But please write to Yoko to pursue the recovery for us.
We'll do that, sir.
Chairman, I think we can make progress.
Paragraph 501, Honorable Park.
Grateful Chairman, unsupported payments, 56,355 Ghana cedis. According to the auditors, they noted that 2 directors made 17 payments totaling 56,354 Ghana cedis, 50 pesos, for various activities without the relevant supporting documents, such as receipts, minutes of meetings, etc., to account for the expenditure. They have recommended that the head of the directorate should recover the total amount from the heads of accounts and same paid into the Auditor General's recoveries account at the Bank of Ghana, failing which the heads of the directories should pay. What is the status of this recommendation?
Honorable Chair, the facility has provided all the documentations to appropriately retire the amount.
In fact, we are speaking about 2. There's Kwong Katamanso, and then there is Tema Metro. So what you are telling the committee is that on both accounts, the documentation has been provided?
What I'm talking about now is about Pong Katamanso.
That is for the 16 PVs.
Okay.
Pong Katamanso particulars, sundry expenses, number of PVs 16, amount 40,543 Ghana cedis, 50 pesos. So let's deal with that.
Yeah, so that has been provided.
Auditors, have you seen the documentation to clear these expenditures?
Yes, Honorable Chair.
Very well. Then, now let's look at Tema Metro Health Directorate. 1 PV, 15,811 Ghana cedis. What is the status
that
of
one
Tema?
has also been provided.
Auditors, can you confirm, please?
Honorable Chair, confirmed.
Very well. Mr. Chairman, the issue has been dealt with.
Paragraph 504, Honorable Ennis.
Thank you, Mr. Chairman. This has to do with non-payment of Tier 2 contribution totaling 3,160 Ghana cedis. What is the update on this?
Honorable Chair, the amount has been paid.
Auditors, can you confirm?
Amount fully paid.
Paragraph 507, that's the Metro Health Directorate. Misapplication of MP NHS Project Fund, 48,270. They have misapplied the MP's fund, 31,000 from the Tema Central MP, and 17,270 Tema East MP. So the recommendation is that the director and accountant should ensure that the two MPs refund the misapplied funds. Actually, the MPs misapplied the funds. Now, this is what the auditors noted. In contravention of the guideline for disbursement of the health insurance fund, the Metro Director, acting on the request of the members of Parliament for Tema Central and Tema East, authorized the spending of a total sum of 124,297 from the MP's Health Insurance Project Fund to pay the recurrent expenditure other than projects as detailed below. Release of funds for Christmas package. Release of end of year socialization for the aged. Support the servicing of official desktop computers. Are all these expenditures health related? Are they to promote health delivery in the constituency or in the district? If they are, then there is no cause for alarm. There is no problem. There's no problem. They are health. In fact, our NHS fund is not only for projects. If you say capital, the recurrent expenditure, it's actually for recurrent expenditure. I use my fund to even do eye screening and eye surgery for people. Yes. So if the Director General refused to send money to the district health office and their vehicle tire is worn out, and I buy the tires for them, it's health related. Because they use that one to do monitoring. It's health related. So your judgment didn't work. I will not approve this. Let's move to it. Paragraph 511, Tema Polyclinic. On self-born, 194,000. The auditors noted that Mrs. Rosemary Salom and Son, a senior nursing officer with staff number quoted, who was granted study leave with pay from June 2018 to September 2022, failed to resume duty after the end of her program of study. In this regard, Mrs. Ansang is required to refund a total of 194,000. Have you recovered the money from her?
Honorable Chair, we've recovered 13,400 so far, and we have been able to get the officer to commit to a payment proposal to refund the rest of the money. Currently, she's in the United States of America.
If our economy is good, we will not be having these challenges. The economy is bad, so they are running away. That is a fact. I'm talking about now. The whole of this report is about what? Unself-born. The number of nurses that have traveled, have gone, if I count them now, I've even lost count. The last time the Director General told this committee that over 3,000 nurses have gone. Yes, only. Anyway, there is hope. We are coming. There is hope. All right. Paragraph 515. Again, another one on earned salary. There are two staff specialists, ONG, and then laboratory scientists, Dr. Shelley Euresi Mensah Brown and Mr. Atta William. They have also been paid a total of 41,839. And so the recommendation is that the recovery should be made from them. Have you?
Honorable Chair, we've recovered the unearned salary in respect of Dr. Shelley Euresi Mensah Brown. She has paid fully with interest an amount of 30,682 Ghana cedis, 24 pesos. That of Mr. William Arthur is still outstanding. We are still pursuing him to recover the amount of 15,390 Ghana cedis, 40 pesos, which is standing in his name.
Have you reported the case to any body, just like Yoko or whatever, to assist the service?
Honorable Chair, I would get more information on that, but we will do that in case it's not been done.
Okay. Auditors, can you confirm the recovery of the 26,449?
Honorable Chair, we can confirm that Dr. Shelley paid 30,682.24.
Okay.
That is inclusive of interest.
The interest, okay.
Yes. So, Mr. Atta, the amount is still remaining.
Outstanding. Paragraph 518, Honorable Ajay Boateng.
Thank you, Chairman. This one has to do with expired drugs. That the auditors, during the inspection, noted that drugs which were held in the stores and the pharmacy, some of them had expired, and the total cost involved is 19,651.29. The recommendation was that you were to constitute a board of survey to appropriately dispose of these expired drugs? Has that been done? Because you promised that you were going to comply.
Honorable Chair, the recommendation has been fully implemented.
Meaning?
We constituted a board of survey, which has given a proposal on how best we have to dispose of these drugs.
Oh, so they have not been disposed of?
No, not to the best of my knowledge.
So the board of survey has not finished with its work? Because the auditors are the problem.
They have finished with their work, but the medicines have not been disposed of. It looks like the facility is here to give more details.
Auditors.
Okay, there's an update. It's been disposed and the certificate is available. So we will submit that to the auditors.
So they have been disposed of?
Yes.
Auditors, are you aware of this?
Honorable Chair, we are aware the expired medicine has been disposed of. We have a copy of the certificate. Thank you.
Okay. Chairman, I think that we are good to go.
Paragraph 522, Honorable Bawa.
Thank you, Mr. Chairman. The Central Mechanical Workshop tema. And infraction is unrecovered debt. And the auditors noted that 59 institutions and then 9 individuals owed a total amount of 721,125 Ghana cedis as at 30th September 2023 for repairs and maintenance of vehicles as detailed in the table. Very long list. And the recommendation is that the fleet engineer should immediately recover the amount from the debtors and pay him into the AG's recovery account. Has the money been recovered?
Which an amount of 515,668 Ghana cedis, 26 pesos have been recovered, leaving a balance of 204,456 Ghana cedis, 73 pesos, which is still under recovery.
So when do we hope to recover this balance of 204,000?
Honorable Chair, this is an ongoing, because the mechanical workshop is in operation, we would always have outstanding debtors at the end of every period.
If you look at the list, it's like most of the debts are not today.
Most of those ones at the bottom, I don't want to mention, they've all been paid. Yeah.
Mr. Chairman, efforts have been made. They've collected substantial, left of only 204 Ghana cedis. So I yield to you.
That's the workshop. That is service vehicle for individuals also.
Honorable Chair, it services vehicles for individuals, other organizations, both private and public, including the Ghana Health Service.
Okay. Paragraph 525, Honorable Amakwata. 525.
Well, thank you, Honorable Chairman. It's the same mechanical workshop. The auditors say that during the review of the stock records and ledgers and other documents of the workshop, they found that 11 items at the Toyota store amounting to 20,189.39 cedis were found missing, and these items were driving mirrors and an injector pump. Their recommendation naturally was that the money should be recovered from the store's manager. Can you update us on the situation as at now?
Honorable Chair, the money has been recovered and it's been paid into the operational account of the mechanical workshop.
What is your position on it, auditors? Auditors, what is your position on it?
Yeah, Honorable Chair, the amount has been paid. It was paid into the institution's account, but the recommendation was that it should be paid into the AG's account. But that was not what they complied with. But in effect, the amount has been refunded.
So how are you going to rectify that? Since it was not paid into the proper account.
I think that this issue crop up when we're doing our work in the region, that if the source of the expenditure is from the consolidated fund, then the refund paid to Auditor General Recovery account would eventually end up in the consolidated fund. But if it is an IGF for the institution, the money should go back to the institution. That is how it's supposed to be. Yes.
Chairman, the reason why sometimes the Auditor General recommends that they should pay into his account is that most of the times you find the institution taking their own money to pay, as if somebody who was incited has paid the money. So in order to forestall that, they say pay into the Auditor General's account, you can apply later and it will be refunded.
So you want to be smart. The Auditor General is smarter than you. Yes.
We hold the same view as the chairman just espoused. And we've argued with them on that. Because if we continue paying these monies into the Auditor General's account, our facilities will suffer. And our patients will suffer. So if the money actually is coming from the IGF, whether it's unaccounted for revenue or expenditure, it has to go back into the IGF.
I agree with you. That's my position too. We'll make a recommendation. Yes.
If you allow me, at times I am personally worried about these developments because if you don't take care, you may take it at its face value. You know, and storekeepers must be properly checked. You know, if items, you know, assuming without necessarily admitting that that was the situation. If a storekeeper takes an item at a particular time and sells it and gets the personal benefit and is detected perhaps over a year when you auditors go round and you simply ask the storekeeper to refund the money, in most cases without any interest. But you should think of replacement costs. You know, if it's item A stolen a year ago and he refunds the amount, assuming it's a vital equipment and you want to replace it after 1 year, as an institution, your replacement cost might be even twice that price. What are we doing, you know, to such people? And time value of money. So you don't just simply ask the person, oh, refund, and then he pays. No, I don't know how you deal with this institution. I don't envy the work of the Director General of Ghana Health Service at all. You know, because all these infractions, we see them a lot. And the management of this institution, you know, you should deal with the subject matters, you know, as seriously as possible. It's not just refund and the person refunds and we leave it. Our country is in a mess. Okay, thank you.
Paragraph 529, Honorable Sam.
Thank you very much, Chairman. Paragraph 529. This has to do with the Municipal Health Directorate in Techiman. It came to the notice of the auditors that the payroll records reveal 2 former employees of the directorate were paid on earned salaries, totaling 24,839 cedis, 9 pesos, for the period March 2023 to June 2023. What's the current situation now? Have you recovered the money?
Honorable Chair, in the case of Imoro Abdul Fatau, it's been fully recovered. He paid 12,188 Ghana cedis, 68 pesos in 2 installments, 2,000 and then 10,120. The difference is in respect of tax. For Ms. Portia Danso, she was not validated for April and May, and there's evidence to that effect from the electronic payment voucher. So she took on earned salary in respect of March. That's 2,644 Ghana cedis, 80 pesos, which she has paid back into the Consolidated Fund and Bank of Ghana.
If I follow your answer, in Portia Danso's case, you said she wasn't validated in April and May.
Yes, she wasn't validated in April and May. So it was for March that she had on earned salary.
June as well, because the auditors say June 2023.
So her on earned salary was for March 2023, but for the rest of the period, she wasn't paid.
Chief, we are saying 2 different things. The auditors say March to June. You
Yes,
say April and May. So then what happens to June?
So for April, May, and June, she was not paid. She was paid for March.
So all she earned was, so it means the auditor's report is wrong.
Yes, the ESPV printout evidences that.
Because in that table, in the table in paragraph 530, then the auditor should have made hers only March 2023. Is that's what you are saying, right?
Honorable Chair, yes. I mean, it's a human institution, so these things happen.
Oh, you don't make excuses for the auditors. They will
okay.
answer their own question.
Okay.
But Imoro Abdul Fatau, you said 12,800 and...
12,188 Ghana cedis, 68
188
pesos.
Ghana cedis, 60 pesos. But the auditors have 14,517 cedis, 78 pesos.
That's the gross salary. So the difference is in respect of tax. So what went to him is the net, which is 12,188.
So why are the auditors capturing the net and not the... why are they capturing the gross and not the net? Auditors. Yes, because if you state that the person took or received the gross amount, when in actual fact what was only paid to the person is the net, gross less tax, it's a misrepresentation. So auditors confirm to us that it is actually the net that was paid, and explain why you are capturing the gross. Because if the tax wasn't paid to the person, that cannot be added. Because you see, when we say that there's been government malfeasance of this amount, it includes all of this that has been tabulated. So if that didn't go to the person, why are you capturing that? Auditors. So in the case of Imoro and then in the case of Portia, it's only March that she earned on earned salary. Why did you say March to June?
Honorable Chair, we did a reconciliation. And then for Portia, we realized that it was only March that was paid. And so she refunded that amount. That is 2,644.08. And then with regards to Imoro, he paid 12,188.60. The difference is tax. We usually pick the gross because there may be other, if you pick the net, you may make a mistake. For instance, if the person has taken a loan and is servicing the loan, that may be deducted at source. So if you pick the net, you'll be making a mistake. So we usually would take the gross. But where in the gross tax, when the person, we take the gross, the tax amount will be deducted, and then the rest would have to be refunded by the individual involved.
Well noted. Chairman, I think that the auditors have explained why they take gross because of any other, and we'll accept that. And then they also admit that Portia's case is just March, not March to June. So I think that has been dealt with. Yes.
Paragraph 532, Honorable Johnson.
Thank you, Chairman. Two former employees of Abrefie Women and Children's Hospital, Techiman, who vacated posts were validated and paid on earned salary totaling 14,345.39 Ghana cedis. Medical director were asked to recover this unearned salary with interest. Please, has the money been recovered?
Honorable Chair, unfortunately, only 1,000 cedis have been recovered from Ms. Gambra Beatrice Akosia.
Please.
That's the only amount of money that has been recovered. And management has requested the assistance of Interpol to track them and to recover the rest of the monies.
Please, where are they now?
Management does not, is unable to, but they are not in the country.
Have you submitted the letter to the Interpol, to the auditors for verification?
Not yet, but we will do that.
Chairman. Another vacation of posts outside the country.
Well, we said we'll have to make some recommendation because this thing is becoming too much. The whole report about the Ministry of Health, majority is about this. It's not good. It doesn't look good at all. The next one, paragraph 535, also on earned salary. One Mercy Sapoma Kote, who also vacated posts in April 2022, was paid salary of 5,284 for the period of April, May, and July. You have to recover the money from her. Were you able to do so?
Unfortunately, we haven't been able to do so. But management actually wrote to her bankers as Universal Merchant Bank in Techiman. But they actually refused to cooperate. So what we are doing now will be to seek the assistance of the security agencies.
Was she also on leave or what? Because if she vacated posts in April 2022, if she was paid for only April, we understand. But here, they pay for May and July. And I'm not seeing June here. What happened? Auditors, she was paid April, May, they jumped June and paid July. Can auditors help? Or is it May, June, April, May, June, and July? Okay. I will not waste much time on there. But the point I want to raise is that he was paid more than 1 month. Why should the officers continue to validate her if she had vacated posts in April? Why should it be vacated for May and July? So we are going to ask, we are going to recommend that this kind of thing, there will be some kind of agreement between 2 or 3 people colluding to do something. So the validator will have to refund the money. Whoever validated this lady, she was paid for May and July. The amount should be completed and validator pay the money. So let's move to paragraph 539. Honorable Afifa.
Chairman, thank you. Lock-up funds at Akuti Rural Bank, 248,757. According to the auditors, 3 health centers and 9 chipped compounds had funds totaling 182,745 locked up at Akuti Rural Bank as at 30th June 2023. Again, on one health center, also in Asen South, also had have a balance of 66,010 cedis, 89 pesos, also at the same bank as at October 10th, 2022. The auditors recommended that the district director should inform the regional health director to liaise with ARB Apex Bank to recover the lock-up funds. What is the status of the lock-up funds at Akuti Rural Bank?
Honorable Chair, so the district director has actually implemented the recommendation, and based on that, the regional director also wrote to ARB Apex Bank to assist, but the money has not been recovered. So the money is outstanding. It's not been recovered from the rural bank.
Is the rural bank, has it collapsed or is it in existence?
Not that we can confirm that. I don't have that. But we have this issue with a number of rural banks. Some of them are in existence, but they only pay salaries and then they close. We have a similar challenge in Gambaga about 2 years ago. Over 1 million Ghana cedis. It's still not been paid. We've been following the ARB Apex. So we have a number of them like that.
Chairman, I yield to you, sir.
District Hospital. Abrad Dunkwa. Paragraph 544. On earned salary, 128,437. This was in respect of Laurentia Abwaji Aqua, a senior nurse staff. She was paid salary totally 128,000 from September 2018 to January 2023, until management learned that she had traveled outside the country. So you have to recover the money from Laurentia. Has she paid the money?
Honorable Chair, she hasn't paid, but we were able to get in touch with the husband, who Mr. Grant Isel Apia. who has actually committed and signed a proposal to pay within 24 months. So we have a 24-month proposal to pay the money.
When is it going to start the payment?
Rabo is starting at the end of this month, so maybe that's tomorrow, 31st.
So the hospital did not know that the lady has traveled for well over 5 years. How can you believe this story? Winneba Hospital, paragraph 548, Honorable Aziz.
Thank you, Chairman. Unremitted withholding tax. Are you able to remit this tax, please?
Honorable Chair, the taxes have been remitted.
Auditors, can you confirm?
Honorable Chair, confirmed.
Chairman, thank you.
Paragraph 552, Honorable Sam George.
Senior Polyclinic, you did not remit taxes of 3,268 cities, 80 pesos after collecting them. Have you paid back with penalties?
Honorable Chair, the taxes have been remitted to GRA.
With penalties?
Not with penalties.
Because the report says, and any penalty arising should be borne personally by the medical superintendent. GRA did not take any penalties, charge any penalties?
No, they didn't charge any
Okay,
penalty.
auditors, can you confirm?
Honorable Chair, the taxes have been remitted.
Chairman, I rest.
Paragraph 554, Honorable Jifa.
So the recommendation, okay, no, the problem is with Mokwa Health Center referencing payments without supporting documents amounting to 38,899. The recommendation has been contrary to the above regulation, which you know. They noted that 37 payment vouchers amounting to 38 has been filed without proper documentation. Yeah? And no official receipts. Now, I want to know, or Chairman wants to know, what the status of that whole business is. What's the status, please?
Honorable Chair, the payments have been fully retired.
Yeah. What is the status, please?
Honorable Chair, all the relevant documents were presented to support the amount.
Repeat yourself.
The payment has been fully supported with documents.
Okay. So we are clear?
Yes.
Chairman, I revert to you.
Paragraph 557, Honorable Frida.
Thank you, Honorable Chair. This has to do with on-end salaries, and the auditors noted that 7 members of staff who separated from the service had been validated and paid salaries amounting to 26,213.14 pesos. And they recommended that the said monies be paid back. In the failure to do so, the district director and the validators should pay. I want to find out if that monies have been paid.
Honorable Chair, we have, I think, the status for each of them. For Esther Amwako and Gifty Ansa, they applied for leave without pay. Actually took their annual leaves. So they took their annual leaves and they did not return. So the payments that went to them was in respect of when they were on leave. So there's no on-end salary there.
Can the auditors confirm
We can
that
confirm, yeah.
Yebua Gifty Ansa and Esther Amwako?
Mr. Chairman, we are here to do that reconciliation. So we cannot agree with their stance. No.
Do you have any further information on that? I don't think you've communicated with the auditors.
Yes, we would provide them with the documentation. For Loretta Entry, she was never paid for the month in question. So in her case to Loretta Entry, yeah, for February 2023, she wasn't paid.
Auditors, can you confirm that for Loretta Entry?
So it's the same as I said earlier on. The reconciliation has not been done.
So when do you intend to do this reconciliation with the auditors? Because if it's going to run through the 7 members of staff, there's going to be a difficult situation for us to clarify.
Honorable Chair, we can do this by Friday if they are available.
Honorable Chair, they are requesting to do the reconciliation with the auditors by Friday. So should I proceed with the next question? Thank you, sir.
Yes, so the next person is Abigail Hayford. She took her annual leave and resigned while she was on leave. So again, there's no on-end salary because the payment was done when she was actually on leave, which an earned leave. Then for Grace Ukala, she also took the annual leave and resigned.
Honorable Chair, I need some clarification here because when you look at 560, management responded that they had written to the relatives of the staff involved to assist in recovering the unearned salaries. And now you are telling us that there's no unearned salary. So what's the... Can you speak to it, please?
Yes, so I think this issue came up earlier. So sometimes management gives these responses, but once they get in touch with the officers involved, they also give the necessary evidence and proof to show that they actually did not earn the unearned salary, or whatever they earned is not for the period that was stated. And going forward, as my boss, the Director General, said, we are thinking of engaging the auditors so that the management letters, the copies can go to the regional directors so that we can assist managers at the lower levels to appropriately answer some of these observations. Because sometimes they just give responses which do not really address or are not, do not address the issues or the facts around the issues.
Auditors, please, so what can you say to the management's response to your recommendation? You are recommending that they pay the monies back. They are saying that they do not earn any unearned salary. But the response they also gave here means that they've written to the relatives for them to assist in recovering the money. So how do you reconcile the two, your recommendation and their response?
Honorable Chair, I think he said that they would do the reconciliation with us within this week. So when we do that, then we can be able to come to a conclusion whether what they are saying is true or not. But we still stand by our recommendation in the report.
Thank you very much, Chairman. I yield to you.
Honorable Chair, I think the status on them is not, there are about one more. So for Grace Okala, there was on earned salary for 1 month, not 2 months. And the 1 month on earned salary, she paid back into the Bank of Ghana account.
So can the auditors attest to the fact that
It's because their names have been mentioned. So if it was, yes. So it was, the earned salary was for 2 months, but one was earned, one was not on earned. And that, the one that was on earned, she has paid back. So when we do the reconciliation, it will come up.
we still have to wait for the reconciliation?
Yes. That of Abigail Nketia was also returned to Chest by GCB Bank.
So we will wait for the report by Friday. Thank you. Thank you, Chairman.
All right, so we'll move to the next one, which is paragraph 561. Honorable Teddy.
Thank you very much, Mr. Chairman. This has got to do with an unaccounted revenue of 9,536,000 Ghana cedi. Now, the Auditor General noted that 6 chip compounds collected a total revenue of 9,536,000 Ghana cedis, but failed to account for those monies. I want to know what is the current state of that amount. Has it been paid?
I would say all the revenues were properly accounted for.
Can the auditor confirm that for me, please?
Honorable Chair, confirmed.
Mr. Chairman, I would want to ask a follow-up question.
In relation to this one?
In relation to this very one, please.
Okay.
I humbly wanted to ask, I mean, aside them being asked to recover the money being owed, is there any punishment that is meted at the defaulters to deter others from doing such acts? Thank you very much.
In this particular case, the revenues were all deposited. It's just that at the time of the audit, they didn't provide the pay-in slips and those, which they have done subsequently, and the auditors have confirmed.
All right. Thank you very much, Mr. Chairman. I yield to you.
All right. That will cover all the 561 up to 565. 561, the whole of that up to 565. So we'll move on to the next one. But I want to take Chuck institution. Ghana Health Service, you'll be talking for long, so I want you to rest more. Chuck, also come and take some. You've taken the oath already. Yeah, so you come this way. Ghana Health Service, we'll finish, don't worry, but let me take them small. So introduce yourselves to the committee.
Yeah, you're grateful, Honorable. Honorable, I'm Peter Yeboah. I'm the Executive Director of Christian Health Association of Ghana. By that, I bring you prayerful greetings and blessings. Thanks. Yeah, I'm here with my colleagues.
Honorable, I'm Enoch Osei Adade, Finance Director. Thank you.
Good afternoon. I'm Samuel Benedict Kokunublega, Director of Human Resources.
All right, so we'll start with paragraph 9, 117. Holy Bridge Clinic and Maternity Home. On earned salary, one Miss Naomi Adade Ankama was paid a total amount of 49,031 Ghana cedis. Between June 2022 and July 2023, even though he vacated posts on 1st June 2022, you are to recover the money from her, have you?
Yes, Honorable Chairman. At the time of the said audit, the nurse in question was on admission at 37 Hospital and later Pentecost Hospital. The challenge had been that at the time of the audit, the responsible officers, the administrator and human resource manager, were not there. So they couldn't relay the information to the auditors. We have obtained medical reports, evidence of admission and treatment, and now the nurse is even working at Achimota Hospital because of we have transferred her. So we defer to your direction in this matter that it is not necessarily vacation of post. It was inability of the institution to explain the rest situation. Grateful.
Auditors, have you seen this information?
Yes, Honorable Chair. At the time, as indicated, there was no information about it, but subsequently, we realized that he was actually receiving treatment at 37 Military Hospital and Pentecost Hospital.
Okay, so that is not on earned salary. That's settled. The next one, paragraph 921, Kalik Clinic and Maternity Home, Akim Swedro. Default in 7 full-born period, 34,423. This is in relation to one Miss Irene Ago Apia, a nursing officer, who was granted study leave with pay in 2019, October, to 2021, October. But she returned and served 2 out of the 3 years of her bond period, after which she vacated posts. So the recommendation is that you should recover 34,000, covering the period that she did not serve. Have you recovered the money?
Yes, Honorable, we have information to the effect that she's in the UK. Thankfully, before we were going to write to the British High Commission, the husband came forward and has agreed on a payment plan beginning next month, which is 2 days' time. So the husband has owned up, and we have some payment plan. Hopefully, within the next 6 months, we should be able to fully recover the amount to forestall or to preempt any possible legal action to retrieve the money. Thanks.
Kindly relay this information to the auditors so that they can do a follow-up.
Yes, grateful, Honorable.
Paragraph 925, Honorable Ajay Boateng.
Thank you, Chairman. This one also is non-redemption of bond, 105,536. And this one is in respect of one NS Owusu, who was also given 2 years, who was granted a 2-year steady leave with pay. And it was supposed to run from November 2021 to December 2023. He resigned on 1st January 2024 without serving the 3-year bond. So the recommendation is that is to pay back the money, the total amount 105,535.61 at the prevailing Bank of Ghana rates. What is the situation? Have you been able to recover the amount of money involved?
Thanks, Honorable Chair. Now, an amount of 30,300 has been paid, and there is a plan of making 3,000 on monthly basis. So that is the position as of now. Thank you.
How long will it take for him to be able to pay this money? You said there was a plan in place, so I only wanted you to apprise the committee.
Yes, Honorable, I think he's doing the mathematics, but monthly installment of 3,000 cedis probably might take about a little bit.
Yes,
of
I
20 months.
understand, but I wanted you yourself to ascertain whether that arrangement that has been put in place would lead to the recovery of the amount, and over what time? Over what time? You can just do some arrangement with him, and it may take 5 years to pay, and we will lose significantly the value of that money.
Yeah, Honorable.
The Chairman, the situation is that some recovery has been made, and they have a payment plan in place.
Okay, that's fine. So, go to paragraph 928, Honorable Bauer.
Thank you, Mr. Chairman. The third paragraph relates to Notre Dame, non-redemption of bond. And the amount involved is 44,391. A staff midwife, Ms. Dorcas Isibenin, failed to serve her required bond period after completing her study leave with pay. The total salaries paid to her from January 2019 to December 20 amounted to 44,390.73 Ghana cedis. And the recommendation is that the head of the facility should recover the total amount of 44,390 with interest at the Bank of Ghana prevailing rate, or recover the amount from her guarantors and pay him into the Auditor General's recovery account. Has the money been collected?
Thank you, Mr. Chairman. Honorable Chair, it has gotten to our attention that the staff is currently at the UK. And so we have written to the UK Embassy to assist us in either recovering the money or getting her back to come and pay. Thank you.
Have you reported to our investigative bodies like you, the IOCO, to assist you? Well, I don't think the UK Embassy is a debt collection agency.
Thank you, Honorable Chair. We would write to IOCO to collaborate with us.
Mr. Chairman, that's the status of the infraction. They said the staff is in the UK, and they are now trying to follow up on our investigative bodies to bring her. The exodus is just
The last time we met, the issue about the check situation was bordered on earned salaries. The situation hasn't changed. Because the subsequent one, most of them are all related to unearned salary, on self-bond and things like that. So this challenge with Ghana Health Service, same challenge with the check institutions also. Anyway, the next one is paragraph 931, Honorable Amakwata.
Thank you, Honorable Chairman. Honorable Chairman, as you did say, I mean, is the same story. This one is in respect of unearned salaries involving 3 members of staff at SDA Hospital, Koforidua, who had on their own volition separated from the hospital, because one of them was even a medical officer, a doctor, and other high-ranking people, through resignation and vacation of post. And they had been paid a total of 27,595 Ghana cedis. The auditors recommended that the administrator of the hospital should do everything to recover this amount, else it should be paid by the administrator himself or herself, as the case might be, and the validators. What is the situation now?
Yes, thank you, Honorable. Honorable, in compliance with the recommendation, the amount has been paid to the Auditor General, to the Auditor General's account as directed. Thank you.
Auditors, are you in a position to corroborate what he has said?
Yeah, Honorable Chair, the total amount has been recovered and paid same to the Auditor General's recoveries account.
Is it with interest or?
Honorable, we pray not so. We were directed to pay the amount 27, and we have acquitted ourselves as directed. Thank you, Honorable.
Paragraph 934. The same SDA Hospital, Kofodia. Non-redemption of bonds. 108,297 to Miss Agnes Doe and Miss Precious Dapa. Have you recovered the money from them?
Thank you, Honorable Chair. The staff are currently in UK and US respectively. And we have written to the embassies, but as advised, we would also write to Yoko to support us in retrieving the money. Thank you.
We will strongly recommend that you don't grant these people steady leave with pay. That will be a strong recommendation. And we want you to comply with that. They go, they don't come back. They go, they don't come back. And yes.
Honorable Mayor, yes, certainly we need to address this canker. The challenge has been that on record about 80 to 90% of those who go on steady leave with pay return to work. We are all beneficiaries of steady leave with pay. So probably we may have to look at those infractions and look at, can they take insurance? Can we look at collateral? Because if we stop the steady leave with pay, to deprive the entire health system of requisite skills, competence that are needed. So let's see how we can have a balance. The steady leave with pay is certainly helpful, and most people are serving the entire health sector. About 90% of staff who are granted steady leave with pay get back and work, and they are working in rural areas. So that would be my suggestion. Thank you, Honorable.
Which courses are they doing, and those courses are not here in Ghana?
Yeah, in fact, in the case of, in our case, virtually all of them are having their courses here, right in the country, post-basic, areas. I mean, in nursing, medicine, midwifery, and all the other areas, allied and paramedical science. In fact, they specialize here, they stay here, and they work. A few of them go, but the interesting thing are those who even went away, some are returning, realizing that the place is not as rosy as they thought. So on record, 90% of staff that we sponsor here stay in the country and work.
That cannot be a justification. We don't want even 1% to go or take the money and run away. How about those of you who are here working?
Honorable Chair, thank you very much. And that's why we are suggesting that we look at other ways of getting them to stay here and work.
Yeah, so if there's a way that you can ensure that definitely if they take their leave with pay and they don't come back, there is some assurance and guarantee that the money can be retrieved. We'll recommend that one. In the past, we have recommended that if they can take a bank guarantee, before you are granted a steady leave with pay, take a guarantee from your banker, and that if you don't return, the institution fall on your banker to pay the money. And before the bank will give you that guarantee, they also have to do the background check and ensure that you definitely return to work. So if that will work, why not? We have recommended that in the past. All right. So St. Joseph Hospital, Koforidua, paragraph 937, Honorable Johnson.
Thank you, Chairman. This same problem, non-redemption of bond. This relates to one Dr. Rita Echampon and Ms. Adjo Sewa, and the money involved is 270,106.20 Ghana cedis. Please have you recovered this money?
Honorable Chair, yes, the money has been recovered and accounted to the Auditor General's recovery accounts.
Auditors, please, can you confirm?
Honorable Chair, after a reconciliation, the amount came down to 184,345.76, which has been paid. Thank you.
Chairman, unfortunately, these persons did not travel outside the country, so the money has been recovered. Thank you.
Thank you. Holy Family Nursing Training College, Nkoko. Are they here?
Yes, we are. They are part of CHAG, so
all right,
represent them.
So paragraph 943 is also non-redemption of bond, 110,164. This is in relation to one Magdalene Omane Owusu. You are required to recover the money from her. She was granted study leave with pay for 2 years. Have you been able to recover the money?
Honorable Chair, 25,000 has been paid, and we have a plan to take the rest from the staff by the end of the year. So as at now, 25,000 has been paid. Thank you.
Is she back at post?
No, please.
So how are you recovering the money?
She was contacted, the family too contacted, and now they are full aware of what is happening. So that is the
How
assurance.
did you recover the 25,000? How did you recover it? They came to pay or what?
Yes, please.
Okay.
She sent it.
Okay. Auditors, can you confirm?
Honorable Chair, 25,000 has been paid, leaving a balance of 85,164.
All right, so make sure that they honor the payment plan that you have agreed with them. Let's have a Salvation Army Clinic, Enum, paragraph 946. Honorable Afrifa.
Chairman, thank you. I think it's the same thing. The payment of on-air salary, 23,135. Say, what have you done about the recommendation?
Thank you, Honorable Chair. She has paid 6,192 cedis, 6 pesos. And there's a plan for her to pay the rest by the 30th of September 2024. Thank you.
Chairman, they are about 5, so she refers to who?
Who's the first person? Yes. What's the letter of the name? Is the yes. Honorable Chair, one of them paid the 6,195. We checked the name and let them have it. But the rest, will pay the rest by the end of September 2024. Thank you.
Chairman, I'll find out from the auditors, but when you look at the names and the amount they are owing, apart from Samuel or Malaysian, who owes 7,404, all of them who owes less than 6,000. So I will presume that it's Sami who paid. So it's he has paid, not they. But Chairman, I just want us to take notice that the administrator of Salvation Army Clinic, Enum, all the letters, the management letters the auditors sent to him for response, he never gave any response in all the infractions at that particular clinic. So I want auditors, can you confirm the payment made?
Honorable Chair, we can confirm an amount of 6,192.06, leaving a balance of 16,943.
Chairman, can you assign a reason why the management of, not the auditors, I mean the chart, why the manager didn't respond to the Auditor General's report or the management letter?
Honorable, thank you. It's very unusual for this this attitude to be, for us to experience this. We assure you we will investigate this matter and update you accordingly. But it's very unusual of any CHAC staff to have, acted in a manner that is unbecoming of a steward. We apologize and we assure you we will update you sooner. Grateful.
Chairman.
All right, thank you. The next infraction is on paragraph 949. Honorable Mutala will take care of that.
Thank you, Mr. Chairman. The auditors have reviewed that the staff records at the clinic, and here we are making reference to, at the clinic revealed that Mr. Samuel Omarisia with staff ID 897358 was granted a 2-year study leave with pay to pursue a Bachelor of Science anesthesia program between 2018 and 2020. He returned after the studies, and while serving the bond term, he requested for a leave of absence in March 2023, which was declined. Despite the decline, he proceeded on the leave, resulting in an unserved bond amounting to 64,546 Ghana cedis, 32 pesos. The recommendation of the auditors is that the administrator should recover the total amount of 64,000 cedis plus, with interest at the Bank of Ghana at the prevailing interest rate from Mr. Omarisio. Has the money been recovered?
Thank you, Honorable Chair. Our checks indicate that Mr. Siao is currently in the UK. And so we have written to the embassy, and we'll follow it up with Yoko to support us in getting the money. Thank you.
When you say you've written to the embassy, you wrote to the embassy yourself, or you did so through the Ministry of Foreign Affairs?
We wrote directly to the ministry, to the embassy.
That would be a bit difficult. You should have done that through the Ministry of Foreign Affairs, because whatever action he engaged in, which occasioned the infraction, is a crime against the state. So if he's in another jurisdiction, it will be between one state to another. You're doing so for and behalf of the people of this country. So I would suggest you do the needful. When did you write to the embassy?
Yeah, Honorable, we yield to your direction in this case. We will do the needful as directed. Grateful.
Auditors, can you confirm that they actually wrote to the embassy in the matter of this?
Honorable Chair, we don't have a copy of the letter.
So I think you should inform the Ministry of Foreign Affairs and let them deal with the embassy there. I think that will have a lot of efficacy than what you've done. Thank you, Mr. Chair.
Yeah, grateful. We will act as directed, Honorable.
Thank you very much. The next infraction is on paragraph 953, and the staff unaccounted for, 716,724. Now, the management at Enum Salvation Army, I'm wondering why they didn't respond to the audit queries.
Yes, Honorable, we have already alluded to the fact that such infraction is quite unusual within the CHAC system. So we will follow up and establish why they did not even respond, but we will definitely follow up and act as expected.
What about this 716,000?
Yeah.
Thank you, Honorable Chair. The staff in question, there were 10, and all 10 had been granted study leave, but at the time of the audit, the approval letters and the bond forms were at the headquarters, and so they couldn't provide it at the time. But we have retrieved all the relevant documents and have communicated same to the auditors. So they are actually in school, and the study leave had duly been approved, and they have signed bonds. Thank you.
I have 11 names over here.
Yeah, it's 10 because one of the names had been repeated, and we have reconciled that with the auditors.
You've done that with the auditors?
Yes, please. Thank you.
Again, without knowing those people at Enum, I would suspect there's a huge management issue out there. The next infraction is on paragraph 957, and it's a Begro, payment of unearned salary, 20,000. What has happened to this amount?
Thank you, Honorable Chair. The amount has been fully paid to the designated account. Thank you.
Auditors, could you confirm, please?
Honorable Chair, confirmed.
Thank you very much. The next infraction is on paragraph 960, and that is also Begro. Default of 1 month prior notice. And the recommendation was to recover this 1 month salary. What has happened to it?
Honorable Chair, the amount has been recovered and paid accordingly. Thank you.
Auditors, could you confirm, please?
Honorable Chair, confirmed.
Okay, now the next one is Hawa Memorial Savior Hospital. And the infraction is paragraph 964. Honorable Frida would take that one.
Thank you very much, Honorable Chair. It's the same non-redemption of bond, which involves one Mr. Kofi Akwa, a staff nurse who was granted 3 years study leave with pay to pursue a BSc Physician Assistant Program from September 2018 to September 2020. He assumed duty but failed to serve his full bond period of 5.5 years before resigning on 17 April 2023. The auditors recommended that the administrator should recover the full amount of 58,730.58 with interest and pay same into the Auditor General's recoveries account, failing which the administrator should pay. Have you recovered the money and paid into the account?
Thanks, Honorable Chair. 11,000 has been recovered, and there is a payment planned of 2,000 to be paid on monthly basis. And Honorable Chair, for your information, Kofi is also currently in UK. Thank you.
Now, all these people going to UK, was it the government that sent them, or they went themselves?
Thank you, Honorable Chair. They went themselves.
Honorable Chair, please, can the auditors confirm the 11,000 payment?
Honorable Chair, we can confirm an amount of 10,908.2 into the Auditor General's account. Thank you.
Auditor, you said 10,900, but did he run it up to 11,000? Because I heard him saying 11,000.
Yes, I said 10,908 Ghana cedis.
And Director, how much did you say?
So we will reconcile that with them. We have the receipts for 11,000. We'll reconcile that with them. Thank you.
But in your response, you stated that it was difficult getting through to them. Anyway, now that you've gotten to them, so they've been able to pay 11,000. So you have a payment plan for him to pay the balance of about, that should be 40-something thousand. How many months did you give him for the payment by installments?
Honorable Chair, now the payment plan per what he submitted is about 20 months. But like Honorable directed earlier, we will employ on him to up it. Because it's our wish that it is paid within the shortest time. Thank you.
Thank you. Thank you very much, Honorable Chair. Honorable Chair, I think that as a committee, we have to do something about this situation. Otherwise, people will continue to do it, and they will decide on how much they want to pay every month, use the state resources, and travel outside the country. We'll be sitting here looking for money to help the same Ghana Health Service and CHAG as well. So I think something has to be done, as Chairman enumerated earlier on. We cannot continue with this kind of situation. Thank you.
All right. Yes, yes, sir.
If you allow me, I have a little concern. Something is running through this report, especially in your case and even in the case of Ghana Health Service. And people continue even to take on-earned monies, on-earned salaries, and so on. And the report, as revealed by the auditors, it's clear that those people were validated. But when it comes to refunding the money, we leave out the validators. We go to the extent of saying that the health administrators, that is the head of the health facilities, should pay in cases where the corporates themselves fail to refund the money. Of course, I may understand, and I want to know two things. One, what is the involvement of the administrators, in allowing these people, who refused to pay, that we should hold the administrators and head of the institutions responsible? What role do they play in the validation, and for that matter, the people, failing to live up to expectation?
Thank you, Honorable Chair. The payments we are referring to are more about discharging the bond obligations of the staff who have been given steady leave to go to school.
Oh, sorry, I understand that. No, I want to draw, Honorable Chairman, I want to draw the attention to the fact that are we being fair? Are we being fair to the administrators of the hospital? No, that should the people who committed the alleged offenses themselves fail to pay? Of course, the buck stops with the administrator. They have the ultimate responsibility, and it's like we are holding them responsible vicariously. Okay, it's like a vicarious liability, and judging from the duties of an administrator of a hospital. Then, if we stretch it, we can say that the Director General of Ghana Health Service should also be surcharged for all these payment, those who have defaulted. And if we go to that extent, because the Director General of Ghana Health Service is the number one person, and vicariously, should he be held responsible for all these infractions in his outfit? Because he will not be there. Why is it that the people who committed these offenses, even the validators especially, they have great responsibility.
Honorable member, let's be mindful about the time.
You say?
Let's be mindful about the time.
Yes, yes. They have, okay, thank you, Honorable Chairman. They have responsibility. So we leave those people out, and we want to hold the head of the institutions responsible. I don't understand. Is it fair? Is it fair?
Yeah. So yeah. You want to talk?
All right. Minister, are you going to answer?
Yes, please. Not the answer. Thank you, Mr. Chair. That is why Dr. Mahmoud Bawumia is bringing the credit report, so that when you do something wrong, it will go to your credit report. Thank you.
Oh, hold on. Chairman, what, Honorable Minister, what did you just say?
When you owe and you don't pay, Dr. Mahmoud Bawumia is bringing a credit record. So when you do something
You mean the driver's mate?
It will go on your credit report. So I think it's a good idea for him to bring it.
Honorable Minister. Honorable Minister. If you introduce politics, we'll be here till tomorrow morning.
Honorable Teddy, the next one is yours. The next infraction is on paragraph 967. It's on end salary.
Thank you very much, Mr. Chairman. Mr. Chairman, this has got to do with 5 staff of the hospital who were granted study leave with pay but did not return to serve their bond. Now, upon the recommendation of the Auditor General, the amount of 576,609,000 was asked to be paid. Has such an amount been recovered yet? Thank you very much.
The amount is on paragraph
573,609.
Yours is on paragraph 967, and the amount is 23,754.
Thank you, Honorable Chair. The amount had been fully recovered and paid into the designated account.
Can the auditors confirm, please?
Honorable Chair, we can confirm an amount of 12,361.3, leaving a balance of 11,392.71.
Thank you, Chairman. I yield to you.
But what about the rest of the amount?
We have the receipts for the payment of the full amount, so we reconcile with them.
Honorable Isaac, could you take the next one, please? Paragraph 970.
Thank you, Honorable Chairman. 970 is a default of 1 month prior notice. And the auditors are saying that 2 staff of the hospital, they tendered in leave of absence and resignation letters, but they didn't provide the required 1 month prior notice in lieu of the 1 month salary, in lieu of the notice. So the amount that they are required to pay in total is 6,710. One of them has refunded 1,000 cedis, and the outstanding balance is 5,710. Has that amount been recovered?
Thank you, Honorable Chair. Amount has been recovered and paid.
Auditors, any confirmation?
Honorable Chair, we can confirm 4,893.64, leaving a balance of 816.77.
So can you show evidence of the full payment to the auditors and reconcile your figures? Chairman, I think we are good to go. They've almost settled it.
All right, thank you. Holy Family Hospital, Techiman, paragraph 974, payment of unearned salary. This was paid to 12 staff. Total amount 229,113.93. You have to recover the money from them, have you?
Thank you, Honorable Chair. After reconciliation, the amount came up to 61,416 cedis 90 pesos. 9,909 cedis 5 pesos had been recovered, and there's a plan for the payment to be completed by the 31st of December 2024. Thank you.
And auditors confirm the reconciliation.
Honorable Chair, we can confirm an amount of 9,909 that has been paid. The rest are still outstanding.
But you talk about after reconciliation. Are you aware of that?
Honorable Chair, we are not aware.
Chuck, did you do the reconciliation with auditors?
Yes. Honorable Chair, yes, the reconciliation had been done at the district level.
Is it with the auditors?
Yes, the audit, yes.
And when was that done? Because if it was done earlier, this would have been communicated to the audit service in Accra. So when was it done?
Honorable Chair, it was done on Friday.
Last week Friday?
Yes, please.
Definitely, Accra people will not know. So, auditors, I think you need to communicate back with your officers in the districts to get a confirmation of what he's claiming.
Well noted, Chairman.
Okay. Paragraph 976, ranking.
Here, the infraction again is unserved bond term. 5 staff of the hospital, right? Well, they were given bond terms, bond money to go and study abroad, and they failed to return. And they were paid from August 2020 to April 2023. That's almost about 3 years. The people are somewhere, Awin Saba, 170,000. Raymond Adu Puahin, 154,000. Ernestina Usu Ajiwa, 124,000. Ajapon Patricia Adoma, 124,000. The medical director should recover an amount of 573,000 with interest at the prevailing bank rate from the separated staff and pays him to the Auditor General's account. Has it been done?
Honorable Chair, please, may we know which facility?
What did you say?
Holy Family.
Holy Family Hospital, Techiman. Paragraph 976.
Thank you, Honorable Chair. 93,303 16 pesos had been recovered. The facility was able to recover 16,755, 16 cedis, and with the help of Yoko, 76,548 cedis has been recovered.
From
Yoko
whi-
is continuing with the process to get the rest of the money
From which
recovered.
of them?
Thank you. For all of them.
That is the total.
Yes, that's the total amount recovered.
Does it mean that they have all paid equal amounts or what? I want details. I want who has paid what. And I want the director to answer. Are you the director? HR director. Okay, then answer it. Okay.
Thank you, Honorable Chair. We don't have the details here, but we can liaise with Yoko to provide that.
Auditors, can you confirm whether some amounts have been paid?
Honorable Chair, an amount of 169,851.16 so far recovered, leaving a balance of 387,003.57 Ghana cedis.
HR director, your figure is different from their figure. Am I right?
Thank you, Honorable Chair. The 16,000 was what the facility recovered and paid directly. But Yoko had recovered 76,548.
The two of them doesn't add up to 160-something thousand that he mentioned. You are not
Oh.
on top of the issues.
Honorable Chair, I indicated that the amount recovered was 93,303.
And the auditors are saying 160,000 or something like that. Am I not right, auditor?
Yeah, Honorable.
So
Honorable
that's
Chair.
why I'm saying that you even don't know what is happening.
Yes, Honorable Chair, clearly we need to reconcile figures and revert sooner. So if you kindly indulge us, we will do the needful sooner and update you accordingly. Grateful, Honorable Chairman.
Paragraph 979, Vice Chairman.
Thank you very much, Mr. Chairman. We are talking about payment of unearned salary, 11,466. What has happened to this amount?
Thank you, Honorable Chair. Samuel Dodu paid 5,000 cedis and had been given a payment plan to pay the rest of the amount by 31st of October 2024.
So does it mean that he will pay the rest by October 31st?
Yes, he's been given August, September, and October to pay the rest of the amount.
Has he made any payment yet?
He's made a payment of 5,000 cedis.
Could the auditors confirm, please?
Honorable Chair, 5,000 has been paid, leaving a balance of 6,466.
All right, thank you, Mr. Chairman.
Paragraph 983. Seventh-day Adventist Hospital, Sefi, Kofi Krom, steadily without approval letter. So 11 staff of the hospital were on study leave with pay, but without approval letter, resulting in a payment of 198,000 as unearned salaries. The recommendation is to recover this amount from the officers involved. Have you been able to do so?
Thank you, Honorable Chair. The approval letters have been provided, and the staff are in school, actually, and the approval letters have been provided.
Auditors, can you confirm?
Honorable Chair, confirm.
Paragraph 988, Honorable Roxon.
Chairman, thank you. Paragraph 988. The case of the auditors is that you approve steady leave worth 190,445 Ghana cedis without authority. And the recommendation, there's a tall list of beneficiaries, so I won't belabor the point. What's the position?
Thank you, Honorable Chair. Approval letters have been provided. Thank you.
Have you brought this, the availability of the approval letters to the attention of the auditors?
Yes, Honorable Chair.
Auditors, you can confirm and verify that approval letters have been provided for all these beneficiaries?
Honorable Chair, we have verified and can confirm that the approval letters have been shown to us. Thank you.
Chairman, that will be all for this matter. Thank you.
Honorable Isaac, paragraph 993.
Thank you, Chairman. 993 on end salaries. Yes, management validated two staff who vacated posts, but they were paid a total amount between the two of them. They were paid a total amount of 7,689. Michael Ousuchum, Mr. Michael Ousuchum, was paid 3,728, and Miss Kiki Siram Avenu Bo was also paid 3,961. The recommendation is to recover the said amount. Has the recovery been done?
Yes, Honorable Chair, it has been done.
Auditors?
Honorable Chair, they are yet to give us those documentations.
Can you make evidence of payments to the auditors? Can you show them the evidence?
Yes, please.
All right, kindly do that. Chairman.
All right. The next one, paragraph 998, Honorable Apak.
Thank you, Mr. Chairman. Steady leave would pay to an unqualified staff, a new twist. According to the auditors, contrary to provision and standards, management granted steady leave with pay to Ms. Comfort Snorita Intiri, an enrolled nurse. According to them, Ms. Comfort was appointed on 15th April 2021. Her approval to pursue further studies was granted on 3rd February 2021, clearly making her unqualified and ineligible to be paid a total amount of 35,891 Ghana cedis 25 pesos. The auditors have recommended that the head of the center should recover the amount with interest at the prevailing Bank of Ghana rate from Ms. Comfort and pay same into the Auditor General's recoveries account at the Bank of Ghana, failing which the head of the center should pay. Why did you grant steady leave to a staff that was not even qualified?
Thank you, Honorable Chair. The staff in question had made a refund of 11,500 and had been given up to the end of October to pay the rest of the money. Thank you.
Honorable Chair, but for the way auditors characterize the process that it was ineligible, the other perspective has been that we serve in most deprived areas. So you may even have a new graduate who just entered the service, working in probably my village, that there's a need, and the person has expressed the desire to stay on to do midwifery or specialize with the guarantee of coming back. So you consider such exemptions or extraordinary circumstance that this person is likely to be retained. So probably we may have to have a second look at that, where someone is working in an underserved environment, has demonstrated a zeal to be trained and come back.
Is it a policy of the CHAC that this is our policy? Then we all accept it.
Yes.
It shouldn't be left for individual managers to take that decision.
Yes. So
make it a policy.
Yes, Honorable. Yes. So we will definitely consolidate or consummate this in a document.
You see,
so that there's a direction there. Yes.
What you are saying makes sense. But if you look at the timelines, it's very strange. The appointment is dated 15th April 2021. And yet the approval to pursue further studies was granted on 3rd February 2021. The auditors have every right to flag this. It doesn't make sense.
Yeah, so
she was even pre-approved for study leave before she was appointed.
So Honorable, this was an IGF staff. This person was an IGF staff, not on government payroll, had been working after school. So possibly it may appear like that.
Very well. Well, next time you need to let the auditors know some
Yes.
of these things in the field.
Yeah, very well.
Mr. Chairman, arrangements have been made and some payments are being made to defray the indebtedness.
All right. Paragraph 1002 on ancillary Bator Kali Hospital. There are 3 staff involved. Total amount 11,265. Have you recovered the money?
Yes, Honorable, full payment.
Auditors,
has
can
been
you
made.
confirm?
Honorable Chair, confirm.
Paragraph 1004 on Ansari St. Anthony Hospital, Georgia. There's one staff, Believe Agbo, 4,827. Have you recovered the money?
Yes, Honorable, acquitted. It will appear that hospitals in Volta region are very compliant.
We observe the laws and respect the laws. In fact, even the amount involved is small amount. We fear a lot.
Yeah, I'm sure he's trying to patronize you.
No.
Okay.
No,
because he knows you are from the Volta region.
we don't want to borrow and
he's
owe
trying
like
to
that.
patronize you.
We don't like to owe cry. Even the amount involved is small. While people are 200, 300, we are around 4,000. Okay, paragraph 1006, also on earned salary. This is SDA Hospital, Sunyani, 3,454. Recovered?
Yes, Honorable.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay, paragraph 1009 on served bond, 410,092 Ghana cedis. This involved one Dr. Ibrahim Abdul Basit Winianam. The auditors have recommended that the medical director recover the amount from Dr. Basit. Have you recovered the money from him?
Thank you, Honorable Chair. The lawyer of the hospital has served a demand notice on the doctor and had given him 14 days, after which a court proceeding will be started against him.
When was that? When was that done?
Yeah, Honorable, barely last week. But the doctor in question hasn't traveled outside the country. He's working in Obuasi AG Hospital. I think he had some challenge after he was sponsored to be a gynecologist and he couldn't communicate well. But as directed, we are negotiating with him to pay back. But he's working in Ghana in AG Hospital and providing care. So we yield to your direction in this case. But our lawyer is pursuing that course of action to retrieve.
Okay, let's leave it to the lawyer to do. Let's see the outcome of the case. All right, paragraph 1012, Honorable Ajay Boateng.
Thank you, Chairman. This is also a case of unearned salary, and the amount involved is 40,915. and it relates to one Teresa Latte, who was also pursuing a program and then was supposed to have returned to the establishment. But she deferred the program midway in the course of the program and has since not returned to work. So the recommendation is that Teresa Latte or her guarantors pay the amount, the total amount into the Auditor General's recoveries account. Has the medical director seen to it that this is done?
Thank you, Honorable Chair. 17,047 cedis, 36 pesos have been recovered from her, and a payment plan has been agreed on to pay from August to 31st December to pay the rest of the money. Thank you.
Auditors, two things. Can you confirm the amount? And have you cited the payment plan, the terms under the payment plan?
Honorable Chair, we can confirm an amount of 17,047 Ghana cedis recovered. Yeah, there's a 6-month payment plan. Yeah, we are.
You are okay with it?
Yes,
all right.
Honorable
Chairman.
Thank you.
That'll be the end.
Thank you. Paragraph 1015, St. Elizabeth Catholic Hospital, HDM, vacation of posts. The amount involved is 92,769 Ghana cedis, involving 2 nurses, Yabua Frank Siama and Osai Adley Asiedua. They have been granted study leave with pay for a 2-year program of studies. They abandoned the program and travel abroad, resulting in the payment of this amount. The auditors are recommended for recovery of the money from them. Have you done that?
Yeah, Honorable. I think we might have interchanged 2 institutions. So the auditors, the other one should have been Wenchi Methodist Hospital, and this is St. Elizabeth Hospital Shidim properly. So we can respond to the St. Elizabeth Hospital Shidim's own now, which is where my colleague will be answering soon.
Thank you, Honorable Chair. I think that the Shidim one was the one who paid the 17,047 Ghana cedis. And
Which of the nurses? Which of them? There are 2.
Yes, both of them.
Both of them paid a total of 17,000.
17,000. And we have given
out of
them,
the 92,000.
Yes, and we have given them 6-month payment plan.
Okay. All right. So, auditors, can you confirm this?
Honorable Chair, confirmed.
All right. So, then the earlier one on the Wenchi, can you give the response to that?
Yes. Thank you, Honorable Chair. The staff is currently working with 37 Military Hospital. We contacted her and made a demand notice, serve a demand notice on her. She proposed a repayment plan of 200 cedis, which we did not agree. And so we wrote to 37 Military Hospital to help us get the money recovered quickly. But they have also written endorsing that that is how much they think she can pay. And we should consider the 200 cedis payment plan. So we seek your guidance in this. Thank you.
she deferred a course.
No, she completed the course.
Well, the report says she deferred
yes,
a course.
Had gone to 37 Military Hospital where she's currently working.
So there was no break.
No, in terms of service, there was no break.
When she was in 37, was she still receiving the salary and then also receiving salary at 37 hospital also?
No. The auditor cited her for not serving the bond.
I think that this should not be an issue. Because she continued and served in the government department. So let's write this one off. So this one is written off.
Yes, Honorable, we are very grateful. We pray, however, that this will not incentivize breaches of bond with particular institution. If that happens, institutions might not be encouraged to sponsor staff, aware that when they finish, they will just relocate to facilities to work elsewhere. We are grateful for this concession, but we hope that this will not be an incentive, for breaches that often we see. Grateful.
Yeah, we'll have to monitor. It shouldn't be. I agree with you. And I'm sure you also have to ensure to attract some other more qualified people to come to your CHAC institutions.
Yes, Honorable. Obliged.
Now let's continue. Paragraph 10.1, 1018. Honorable Amakwata.
Thank you, Honorable Chairman. It's the same institution, St. Elizabeth Catholic Hospital, Hwidim, 1 Sulaj failed to resume work at the expiration of his leave period. However, he was validated and paid an amount of 2,304 Ghana cedis. The auditors recommended that the amount should be retrieved by the medical superintendent with interest. Is it done?
Yes, Honorable Chair, it's been paid.
And how can an absentee person be validated? Somebody who did not even return from leave. Did you find out that from the validators?
Chairman, this was just after they leave, so 1 month, that was just the overlap. So the moment it was noticed, it was rectified, and now it has been recovered. Thank you.
Okay, Chairman.
All right, thank you. Paragraph 1020, Honorable Sampson.
Thank you, Mr. Chair. One Kwame Jemfi failed to serve bond. The amount involved is 19,068. You were supposed to recover the amount. Has that been done?
Honorable Chair, yes, it has been done. Thank you.
Can you confirm?
The full amount has been recovered.
Thank you. Paragraph 1023 is on earned salary, 223,314 Ghana cedis. Akuma SDA Memorial Hospital. How do you pronounce? Kochia. Is that the pronunciation? Kochia. Kochi or Kochia?
Kochia.
Kochia. What is the meaning?
Very well, Honorable, we shall consult and get the meaning for you.
All right, this one is serious. Auditors noted that the hospital, that one Dr. Michael Anku was granted study leave to pursue a 3-month program in medical German language and knowledge course, which was extended for another 6 months, ending 30th June 2022, prior to obtaining final approval to pursue the 6-month program in 6-year program in neurosurgical residency training in the Northern Westphalen. Dr. Anku wrote to discontinue his program and has since not returned to post. The auditors also noted that even though Dr. Anku vacated post, management validated and paid on earned salary amounting to $223,313. So the auditors are recommending that the amount should be recovered from Dr. Michael Anku.
Thank you, Honorable.
Have you recovered the money?
Yes, Honorable Chair.
Auditors, can you confirm?
Honorable Chair, confirmed.
All right, so let's move to the next one, paragraph 1026. SDA Hospital, Dominacy, unserved bond term. One Stephen Sarkodie, who is a nursing officer, vacated post while serving his bond duration after completion of study leave with pay. The total amount is 81,712 cedis. You have to recover the money from him, have you?
Thank you, Honorable Chair. Our checks indicate that he's currently in Canada. We have written to the Canadian Embassy, but having been advised, we'll rewrite through the Minister of Foreign Affairs and also solicit the help of YOCO to support in the recovery. Thank you very much.
Okay. It should be the Minister of Foreign Affairs who can then relate to the Ghana Embassy in Canada. I'm sure it's going to be on either Ontario or Ottawa to trace him. SDA Hospital, Bremen, paragraph 1030. Also, salaries in lieu of notice, not forfeited, 125,000 Ghana cedis. The auditors noted that 13 staff of the hospital left the hospital without notice. But the nurse manager, Teresa Nyaku Nkrumah, issued introductory letters to aid them to travel abroad. The total amount is what I mentioned, 125,775. The auditor recommended that the head of the hospital should recover the total amount from the former staff and pay same to Auditor General Recovery Account. Have you done that?
Thank you, Honorable Chair. An examination of the ESPV voucher indicated that he was not validated. Their payments of salary to them had been discontinued, and so they have not been paid for the period. Thank you.
So the 125,775 was actually not being paid to them. Is that the case?
Yes, Honorable Chair.
Okay, auditors, can you confirm?
Honorable Chair, I think we need to do some reconciliation.
Okay.
Thank you.
You need to do reconciliation
Yes,
before you
Honorable
can
Chair.
confirm. All right. So you do that and update the committee.
Honorable Chair, this is salaries in lieu of notice.
Yes.
So they should have given 1 month notice.
Notice.
But in this case, these people did not resign, they vacated posts. So when it happens in that way, there's no way they are going to give you that notice. So
But were they paid for that 1 month?
no
Were they-
place.
Okay, so auditor just confirm that they were not paid. And once you confirm that they were not paid, that ends the matter.
Well noted, Chairman.
Paragraph 1033. On self-bond term, 159,000. One Miss Claudia Osei Tiwa was granted 2 years steady leave with pay. And one Miss Osei, no, the same person, she failed to resume work after the period expired. But she was paid this total amount. So the recommendation is that the amount should be recovered from her or her daughters, no, her guarantors. Have you recovered the money from her or her guarantors?
Yes, Honorable. Thankfully, the said staff is back and is serving her bond fully. So she's now at post.
Auditors, can you confirm?
Honorable Chair, confirmed.
All right. Then let's go to paragraph 1037. Jenny Speaks, AME Zion Hospital, Akumadan, on earned salary, 3,439 Ghana cedis. Have you recovered the money from Miss Yvonne Baden?
Thank you, Honorable Chair. The salary was discontinued on the ESPV voucher, and so she hadn't been paid.
She has
for
not
the
been
month.
paid.
No.
Auditors, can you confirm?
Honorable Chair, confirmed.
That'll be all for Chak Station. You are discharged.
We are grateful. Honorable, remain blessed.
We don't clap in Parliament, okay? Yes. Let's come back to Ghana Health Service. I'm sure they have rested enough, so we can continue with them. All right, thank you very much. Ghana Health Service, welcome back. Let's go to paragraph 612. Mfantsiman Health Directorates. Mfantsiman Municipal Health Directorates. Unserved bond. One Frank Emisa, a senior staff, was granted steady leave with pay, but he defaulted in serving the bond terms. You have to recover the amount from him. Have you recovered the money? Ghana Health Service.
Honorable Chair, only 2,000 has been recovered so far. But he has come with a payment plan to pay the rest over a period of, I think, 24 months.
So they themselves come with a payment plan? Or is something that...
They agree with the management of the facility.
Auditors, out of 71,000, only 2,000 have been recovered. Can you confirm that 2,000 recovery?
Yeah, Mr. Chairman, only 2,000 has been recovered.
Where is Mr. Frank Emisa now? Is he in the country or is also outside the country?
Honorable Chair, we don't have that information immediately, but we can get it.
But how did he come for a payment plan?
It's a family.
The family. Okay. Paragraph 616, Honorable Mutala.
Thank you, Mr. Chairman. It's unlodged revenue. The auditors have noted that from the review of the financial records, the revenue totaling 9,076 Ghana cedis 50 pesos was collected between May 2022 and April 2023. Out of this amount, only 3,662 was lodged in the service bank accounts by the accountant, leaving a balance of 5,414 cedis, 50 pesos unaccounted for. And the detailed here, the recommendation of the auditors is that the district health director should recover the total amount of 5,414 Ghana cedis, 50 pesos with interest at the prevailing Bank of Ghana rate from the accountant and pay same into the Auditor General's recovery account at the Bank of Ghana, failing which the district health director should pay. Have you been able to recover the total amount of 5,414 Ghana cedis with the accompanied interest?
Honorable Chair, the total amount of 5,414 cedis 50 pesos has been recovered, but without the interest.
Why? But the auditor's recommendation is that you recover the total amount with the necessary interest.
Honorable Chair, we would recover the interest.
Auditors, can you confirm that the total amount of 5,414 has been paid?
Total amount has been paid.
Thank you, Mr. Chair.
Paragraph 619, Honorable Aziz.
Thank you, Chairman. Payment of an in salary, about 129,567 Ghana cedis. Are you able to retrieve this amount? 129,567. 619. No 62. Okay. 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 It's the same thing. The infraction is the same, an in salary. But it's 25,092 Ghana cedis. Are you able to retrieve this amount?
Honorable Chair, we've recovered all the amounts. All of them have paid.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay, Chairman.
Paragraph 623, payment of unearned salary. The amount is 4,383. Have you recovered the money? This is
Honorable Chair, all the monies have been recovered.
District Health Directorate, TRC.
The monies have been recovered.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay, let's move on to paragraph 627. Honorable Jifa.
Payments of an end salary amounting to the tune of 129,567. 567. And this was for a period of from November 2020 to June 2023. The recommendation was that the medical director recover the amount of 129,567 from the officer involved with interest at the prevailing Bank of Ghana rates and same paid to the Auditor General's recovery account at Bank of Ghana, failing which the medical director and the validators should pay. What is the situation now, please?
Honorable Chair, the total amount of 129,000 plus remains outstanding, unfortunately.
And what have you been doing about it so that it be retrieved and the recommendation complied with?
All efforts to reach the staff, that's Elvis Achampon. All efforts to reach Elvis Achampon has proved futile. So management is trying to get the assistance of the security agencies, maybe Interpol, to see if we can track him and recover the amount.
Chairman, the period under review is November 2020 to June 2023. As we speak, we are in July of 2024. So your answer really is not encouraging. We are in July of 2024.
Chair, we will engage the medical director in the hospital to comply with auditor's request.
Chair, I yield back to you.
Director General, this issue, we only have to encourage you to find a solution to the problem. Paragraph 631. Equipim non-municipal health directorates. Wrong placement on salary scale, 14,951. One Kwame Pabi and Audley was wrongly placed on a rank of dispensing assistant, resulting in the overpayment of this 14,951. You have to recover the money from the officer involved. Have you done that?
Honorable Chair, management did not agree with the recommendation of the auditors. And it is so because at the time the officer was employed as a dispensing assistant, that grade was an auxiliary grade. So just like the orderly grade. It's in recent times that they do a 6 months program, and the grade has been elevated. So at the time that he was recruited as a dispensing assistant, he was on the right grade. So when the issue happened, he was sent back to the dispensary. He's subsequently actually gone to do the course of the dispensing assistant and acquired that qualification as such. But at the time that he was employed, he was on the right grade.
Have you done that reconciliation with the auditors?
No, we haven't done that reconciliation with them.
So the auditor will still hold that position. Or auditors, do you agree with him?
Honorable Chair, we still hold the position until we reconcile with them and see where they are coming from.
All right, so they disagree with your finding. They have evidence to prove, so you have to go and verify the documentation that proves that at the time he was employed, he was put on the right grade. So there was nothing like overpayment to him. You need to do that. Your officers at the district or the region should do that as early as possible. Paragraph 635, on earned salary, 3,325. This is Municipal Health Directorate, Kibi. Have you recovered the money from one Margaret Kunwa Kwapong?
Chair, the money has been recovered.
Auditors, can you confirm?
Honorable Chair, confirmed.
All right, paragraph 642. Yeah, 642. Abuakwa North Municipal Health Directorates. Failure to serve bond term, 81,411. One Miss Florence Wangna, Jambuzi Wangna, was granted study leave with pay, but she did not return to serve a 3.5-year bond term. You have to recover the money from Ms. Florence. Have you? 2 years. Bond term for, no, 3.5 years.
Honorable Chair, we were able to get in touch with the officer. That's Ms. Florence Jambuzi Wongna. She has paid 64,140 Ghana cedis, leaving a balance of 17,270, which we are still pursuing her to complete the payment.
Auditors, can you confirm the amount refunded?
Honorable Chair, confirmed.
All right, so continue to recover the balance. Okay. The next one in paragraph 645. District Health Directorate, Adabo Chrome, Bia East. Expenditure not fully accounted, 8,155. You are to recover the money from the accountants. Have you?
Honorable Chair, an amount of 2,760 has been recovered from the accountant and paid into the Auditor General's account. Two of the payment vouchers amounting to 5,395 were retrieved and retired and submitted to the auditors for verification.
Auditors, can you confirm?
Honorable Chairman, confirmed.
Okay. Paragraph 467, Vice Chairman.
Thank you very much, Mr. Chairman. Now, this is a case where the District Health Director and the Head of Finance spent the MP's portion of the common fund without permission from the MP. The recommendation was for the District Health Director and the Head of Finance to refund the amount, which is 22,814. And then we further recommend that the District Health Director and the Head of Finance should be sanctioned accordingly. First question, have they refunded the amount? And two, have they been sanctioned? This is on the DSO District Health Administration.
Honorable Chair, the region sent some updates just when we came here. Honestly, we haven't been able to look at them. So, as we speak, As we speak, it hasn't been paid. Let's put it that way. Yeah.
You see, auditors, this happens a lot. Those of us on this commission, we are MPs. It happens a lot. You go there and the portion they've given you, the amount is gone. And instead of them telling you, what they would tell you, the DC or the heads, they will play games with you. They don't want to approve it because they spent your money. And now that we are getting to elections, then they use it against us too. This amount hasn't been refunded. But the second part, have they been sanctioned? Musika nsumudi anamudi yede.
Director General, do you give money to your district and municipal health directorates?
Yes, we do. We do.
I ask this because most of the time they have to fall on the MPs. They have to fall on the MPs asking for. But I've been buying sometimes computers, printers, the ties for their pickups. Yes. All those are demand from this department on the MPs. And the health insurance fund that is lodged there, which we should use for the health delivery, we use it to spend it on the office. That is why I asked that question.
Yeah, we do, but I believe it's still not adequate enough for their needs. And some of them are earmarked and for specific areas. We are working towards trying to see how we can have some resources that are a bit not earmarked to support them. But I believe that we still know that the amount of funds that go there is woefully inadequate.
It's not painting a good picture. Because they always follow the MPs. They always.
I know.
All right, so let's go to paragraph 657, Honorable Roxon.
Chairman, thank you very much. At the workroom, the case of the auditors is that as much as 168,478 Ghana cedis was paid to some persons who were not supposed to earn it as salary. I won't bore you. What's the status of this money? At the workroom,
Chair, yes, we've identified this challenge. They didn't have any approval to do what they did, so we intend to investigate and apply the necessary sanctions. They did not have any approval to take the decision they did.
what's troubling is that the number of months that this continued, the unlawful validation for which these monies were paid. 12 months, that's a respect of Grace Bafu, who actually took chunk for a whole year. I'm happy that earlier on in the day, DG and I spoke about this matter. So DG, you see that for the long hours that you've sat for us to interrogate these matters, on-end salary is replete in a lot of your agencies and institutions. So, and I'm happy the Honorable Minister too is here. Let's deal with this matter with some pragmatic measure. The audit findings is 2 years old, July 2022, July 2024. And if we still are unable to recover any at all of this money, it's troubling for myself and the committee. So I want to urge you to endeavor to recover the monies from these people. Otherwise, then it gives others that courage to engage in similar conduct. Yes. Chairman, yes, no recovery. So we are encouraging them to endeavor to recover these monies. Quite huge, especially for an institution like Adabokro. They need it to be able to do their others, engage in other services that they render. Thank you.
All right. The next infraction is on paragraph 661. Honorable Isaac would take that.
Thank you very much, Chairman. Chairman, again, is unearned salaries. It's an issue that we really, have to find an antidote. Chairman, 6 separated staff were paid a total amount of 47,883 cedis, 48 pesos. So the recommendation again is to recover the amount. Has the recovery been done?
Honorable Chair, we've been able to recover some. So 2 out of the 6 people have paid. That's Ruth Kofi Nanaba. She has paid 3,419.36. Isaac Nkansa has paid 4,016.36. So we've recovered 7,480 Ghana cedis, 72 pesos from the 47,883.48 cedis. We are yet to recover from the other 4.
Have you been able to make contact with the other 4?
We haven't been able to make contact with them, but we've reported the matter to the police commander. That is what the facility has done. But from head office and the region, we will step in to ensure that the measures they take go beyond that to become more effective in the recovery efforts.
All right. Before I go to the auditors, Chairman, I think it will be important if they can put a committee together, to look into this particular matter, because it's becoming, one too many. Sorry, can you confirm that 7,000 out of the lot has been paid, has been recovered?
Honorable Chair, the amount is 8,484.36.
What has been recovered so far?
Ruth Kofi paid 4,419.36. And then that of Asantua, Isaac Nkansa, 4,419.
But the amount against him is 3,000.
But that's the amount actually paid into the recoveries account. So
if that is the case, then we may have to, I don't know whether it includes interest. Otherwise, if it is in excess, then we may have to refund the excess back to him. And Barbara has paid 4,000.
It's 4,061.36.
So the remaining, I hope, you pursue the recovery.
Which I will do that.
Chairman.
Okay.
All right. Paragraph 63. Municipal Health Administration, also contract awarded to unqualified suppliers. The amount is 151,000. It was awarded for supply of laptops, drugs, and sanitary. No, stationery, sorry. Between the period September 2022 and June 23. The supplier did not possess the requisite documents such as PPA, registration certificate, tax clearance certificate, and others at the time of the audit. Recommendation is that the Municipal Health Directorate and the head of procurement be sanctioned in accordance with Section 92 of the Public Procurement Act. This one, you will not do that, so we will do that recommendation. Yes. So clerks, take note. They need to be sanctioned in accordance with the law. Paragraph 666. Unpresented GCRs, 24,000. Have you recovered the GCR from them, or you recovered the money from
we've
them?
recovered all the GCRs and presented them for verification.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay, paragraph 669, unaccounted revenue, 20,371. Have they accounted for the money? That is severe also.
Honorable Chair, all the money has been recovered.
Okay. Auditors, can you confirm?
Honorable Chair, we don't have the full details here.
Do you have the evidence here?
Yeah, we have
Right.
it. We have it, but we didn't, it's in the office, yeah. But we also had a soft copy which we shared. That was early this morning.
The soft copy of what?
Of evidence of the payment of this amount.
And it's a revenue, so evidence of payment to the bank account?
It was paid to, where is it? I think Bank of Ghana, because the advice was for us to, it was paid to the Consolidated Fund in Bank of Ghana.
So provide evidence to the auditors.
Okay.
So that's all. Paragraph 673, unapproved study leave. So you granted study leave to a number of people which were not approved. The superintendent of the hospital invested for, in a letter dated 21st May 2021 to the director of the University for Development Studies, released 12 nursing staff to pursue various programs. The auditors noted that only 3 out of the 12 were eligible to be granted study leave. The recommendation is that the medical soup should recover the amount and any subsequent payment with interest. Have you recovered the amount from them?
Chairman, no, we've also realized that we don't do retrospective approval of study leave, and there's no evidence that the regional director had given any written instruction for that. So we investigate and apply the necessary sanctions. We agree with the auditor's recommendation.
Did you say you agree with the recommendation?
Yes, sir, because I don't think it is as appropriate. It's never done anywhere.
So you have to recover the money from them?
Yeah, we will recover from them.
Paragraph 677. It says the management stated that this was a special arrangement with the regional director.
All right, so kindly recover the money and inform the auditors. Paragraph 679, vacation of posts. One Esther Ohiniwa Blanson, vacated post, was paid this amount. You have to recover the money, 5,857. Have you?
Honorable Chair, is recovered. The amount has been recovered.
Auditors, can you confirm?
Honorable Chair, the total amount has been recovered.
Paragraph 682, Honorable Ajibwat.
Thank you, Chairman. Enchi Government Hospital, collection of unapproved charges. The auditors noted that the hospital charged patients utility fees, CS fees, and others without approval from Parliament. Management has some problem with the auditor's position. So the auditors ask that management investigates this issue so we can come to the bottom of the case. No direct recommendations were made, except that after the investigations, those who were found culpable were to be sanctioned, and an amount of 236,400 was to be refunded by them. I don't know whether you have been able to resolve that matter, because you were supposed to investigate. That's the first thing that the report asked you to do.
Yeah, thank you, Chair. The investigation was done and it was stopped, but we need to make sure it doesn't happen again. We actually invited the doctor responsible to be here to also give any explanation if he has any for us.
So he's here with you?
Yes, he says.
Right, so if there's something that you can. But let me get back to you, Director General. The investigation that was done, was it established that the fees which were collected were unapproved?
But that's why I said that a lot of some of the management reports doesn't get to us until the time of the report comes out. So to help us to be more proactive. I think the region conducted their own investigations, and that's why we've invited the doctor to kind of explain the investigations and the rationale for which those things were done.
I don't know whether the chairman, we have the luxury of time to be able to go through this. Because that was why the auditors recommended that you should investigate. So if you investigate and you establish the facts of the case, then you go ahead and implement the recommendations of the auditors. I think it will save us a lot of time.
But are you still collecting these unapproved fees? This one come to the doctor, medical soup. Are you still collecting the fees? Use the mic, put it on.
Honorable Chair, please no.
All right, so the recommendation is that, kindly introduce yourself so that we can capture your name.
Yes, I'm Dr. Emmanuel Kwesi Kumsin, Medical Superintendent of Enchi Government Hospital.
So the amount involved, the 236,000, was paid by the patients who came to the hospital. Is that the case?
I think there are two sections. One that was called utility, and another section that was called operation charges, if I may put it that way. Yeah, so for utility, it wasn't actually utility. Well, I mean, what I inherited is that we had a problem with ECG and power generation. So the Hospital Advisory Committee met, that is 2016, and agreed that each person who comes to the OPD pays an amount. So from 2016 till this audit was done, I think this captured 2020 to 2023. We have been taking that amount for fuel for generator and X-ray repair of an old X-ray machine. So since this came up, we have had to stop it.
Please go ahead. So the money was collected was used to
Yes, buy fuel for the
buy
generator.
fuel for a generator.
Yes.
Okay.
Because especially with the LEMS coming on board, the power from the ECG itself cannot power the theater equipment, especially the air conditioners, and then the server. So we've had to put on the generator even though ECG power is on. So it was helpful.
Well, that was done during that time to solve the problem you had at the time. Is that the case?
Yes.
But you are no more collecting it?
Yes, since the audit observation, we have stopped collecting it.
So has the problem been solved?
The problem is not entirely solved because still there are two lines that come to Enchi.
Okay.
One from Asankregua and one from Elubo.
Okay. Elubo?
Elubo, yes.
Okay.
That's the power lines that we are all on. So the one from Asankregua has so much load that when that one is connected to Enchi, we cannot power any of our equipment. Just the fan and lights comes on.
Oh, okay.
So even though there is power, we have to put on the generator. That gives us a lot of cost. So in discussion with the community, so it was a community agreement, we were on radio and all that. But I think they are right that we need to get the approval from Parliament.
So, Director General, I think this one, the ministry, your office must also step in. Just like you are stepping in to resolve the problem of my hospital in Hueta. Because the transformer has been blown off. There was a thunder that blown off the transformer, which you are helping for us to procure a new transformer. So far, we have spent money. I have spent money for fueling the generator. The similar problem is what they are facing. So you have to step in. I beg you, do something about this. No, they have the generator. It's the fueling that is what the problem is.
So buy the transformer
for which people? For the hospital. No, I'm talking about Enchi. My place, the Director General is buying the transformer for me.
Buy it yourself.
No, it's a big problem because if it's about generator, they have it. It's the money to fuel it. But in order to stop that, then what should be done about the line? And that also going beyond your ability as a ministry. So there must be collaboration between Ministry of Energy. And it's something that, Clark, take note of this. We need to recommend something on this. All right.
Thank you, Chair. We will engage and we want to also ensure that such decisions are brought to the fore so that we can all have a decision. We have a backing.
Yes.
This is what we are doing. And
Okay.
we hope
All
that
right.
others doing that will also not do that.
So don't collect those fees again until they are approved, or we work on the problem and resolve the problem. Thank you very much for coming. Let's have the next one, District Hospital, Wichau. Paragraph 690. Honorable Bauer.
Thank you, Mr. Chairman. And Wichau issue is caption taxes not remitted, 6,121. And the auditors noted that the accountant at Wichau Hospital withheld taxes totaling 6,120.74 from various payments, but did not pay the tax to GRA. A table here detailing the collections and the amount due for tax. And the recommendation is that the tax should be immediately remitted to GRA. And then any penalty arising from the delay should be borne by the accountant. Has these taxes been remitted? And were there any penalties paid?
Honorable Chair, the taxes have been remitted. There were no penalties, but the taxes have been fully remitted.
Auditors, can you confirm?
Honorable Chair, confirm.
That's what, Mr. Chairman.
The next one, paragraph 693, Honorable Sampson.
Mr. Chair, Golo, tier 2 contribution, 3852. What is the status?
Honorable Chair, we've been able to identify the fund manager enterprise. They have registered the individual contributors and they are waiting for a code so that they can pay the money. So the money is in the account. Once they get the code, they will pay the contribution.
Auditors, are you aware of this?
Honorable Chair, we are aware.
So the money is safe, auditors?
Yes, Honorable Chair.
Thank you, Mr. Chair.
Paragraph 696, Honorable Johnson.
Thank you, Chairman. Tumu Municipal Hospital, one Mr. Bene Jaladi Moro, who wasn't an employee of Ghana Health Services, managed to get his name onto the hospital's payroll. He was validated and paid a total amount of 75,389.39 Ghana cedis. Later, he detected and he was made to refund 17,000 out of the amount, leaving an outstanding balance of 58,387.39. Medical superintendent was asked to recover this amount. Please, has the money been recovered?
Honorable Chair, all the monies have been recovered.
I believe it was a criminal issue and you were advised to prosecute him. Have you done that?
Yes, the matter has been reported to the police. The matter is with the police.
For how long now?
We can check exactly for how long, but the matter has been reported to the police. That we can confirm.
I think you should be able to give feedback to the auditors as to what is happening at the police station. Thank you, Chairman. The money has been retrieved.
Okay. Paragraph 701 is on rejected National Health Insurance Authority claims, 122,561. The auditors noted that this amount was rejected between August 2021 and July 2022. And the reasons cited for the rejection include wrong application of tariff, overbilling of medicines or service, duplication of claims, inappropriate prescription of medicines, and expired health insurance membership card. And then we have a table that gives the total. So 122,561 was rejected. The auditors recommended that the municipal health director to identify staff whose negligence occasioned the loss and recover from the officers involved and pay same to Auditor General Recovery Account. They also recommended that the municipal health director should increase supervision over the review and vetting of claims and regularly train prescribers and vetting officers to ensure that medicine are prescribed per the guidelines of the health insurance to avoid rejection. What action did the management take on this recommendation?
Thank you, Chair. There were a couple of challenges that they had. One was changing the electronic system and putting the claimants that will help them identify wrong allocation of names to claims. Number two, also they didn't have the verification system that will allow them to see whether an insurance card is expired or not. All that has been put in place so that they are able to identify that this card is expired. If it has expired and made a claim, obviously it will be rejected. You also place them on the electronic medical record system that helps them to make processing much easier and more accurate. So since then, the problem has been solved.
So no more overbilling, no more wrong application of tariff?
That will be difficult with the electronic management record system.
Okay. So the hospital has lost this amount. Has the management investigated and identified the officers who caused this problem?
Chair, we think it was more of a structural problem.
Okay.
And so that's why we're putting in the new system to correct it.
So we have lost the money and nothing we can do about it.
Some of the monies they actually didn't earn, like the duplicated
The
bills.
duplicate ones, they didn't earn those
The wrong diagnostics. The expired, yes, expired cards. And
Well, the duplicate one, they have not earned them but we don't have that figure. Because
we don't have the breakdown to know.
Yeah, we don't have the breakdown, so we don't know whether it's only 10 cities or what. So let's assume that we have lost everything, and that ends it. Paragraph 705, health purchase of vehicle, 288,000.
Which the money has been refunded to the hospital.
Okay. Auditors, can you confirm?
Honorable Chair, confirmed.
The next one, paragraph 710. Unrecovered staff advance, 10,590. Recovered?
Was partially recovered.
How much?
3,989 Ghana cedis, 80 pesos has been recovered. So we still have 6,600 to recover.
Auditors, can you confirm the recovery?
Honorable Chair, an amount of 3,989.80 recovered.
Are these staff still working with the hospital? The one municipal hospital?
Yes, Honorable Chair.
So they should recover the balance.
Okay, thank you. We'll do that.
Paragraph 713, Regional Health Directorate, WA, unrecovered rent, 80,900. Have you recovered the money?
Now, Chair, we've recovered partially. So 35,400 has been recovered. We still have 45,500, which we are under recovery. We are also mechanizing the deductions.
What plan do you have to recover the balance?
Apart from mechanizing
No, the mechanized one will prevent the accumulation of the rents. But these arrears, how will you recover? You have recovered 35,000, right?
Yeah.
I'll ask auditors to confirm that, but the balance, how are you going to recover it?
Honorable Chair, we will pursue them and try to agree on some payment arrangements or plans to recover them within the shortest possible time.
Auditors, you need to provide them with a list because we don't have the list here. So provide them with the list if they don't have it. But if they have, fine. If they don't have, provide them with the list so that they will know who and who to recover the money from. But can you confirm the 35,000 they claim to have recovered?
Honorable Chair, an amount of 35,400 has been recovered.
All right. Paragraph 716. That is Lambousier Polyclinic. Unpresented payment vouchers, 4,630. The recommendation is to recover the money from the accountant. Have you?
Honorable Chair, the vouchers have been submitted to the auditors and verified.
Auditors, have you verified?
Honorable Chair, yes, we have verified it.
Paragraph 719, Honorable Jifa.
Chairman, it's on revenue not accounted for Tumu Polyclinic. The amount in question is 5,518. The auditors advise that the in charge should recover the said amount. It's derived out of a total of 16,709. That's how much was appropriated, and no, that's how much has been refunded already. The outstanding is the 5,518. What is the current situation, please? Has it been refunded?
Honorable Chair, all the money has been refunded.
Chair, does this committee have the power to punish people who just take a refund? If there's no punishment, that's what we've been sitting here doing all the time. There has to be some kind of punishment, no? Chair, I'm seeking your guidance.
Yeah, I'm listening to you. I thought you have not finished. That is why I'm watching.
I'm quite finished. You know, how an individual can be allowed to just pull out all these resources, be found out, instructed to refund, they refund at their pace, and then we come and sit here for hours, talk about it, and again and again and again. There has to, no consequences. And if there are no consequences, it will go on.
We are guided by the public. You will see that some of the infractions, they will say we should recover with interest. The interest serves as a punishment. But in some cases, you need to be punished, by which you have to be referred to the the Attorney General for prosecution. And there are some few ones that I have noted, like procurement breaches. We'll refer them to the Attorney General for prosecution. If the judges, and that is why they keep on doing it. For instance, from the accountant and pay same to the Auditor General Recovery account. So I ask a question, has the money been recovered? And the answer will be, we have submitted the receipts and the necessary document to authenticate. That is the answer they give. Then I ask the auditors, have you said, oh, they have brought the document, we have verified and we are satisfied. We are not actually doing the right thing. Most of these things are just being overlooked. So you've asked a relevant, very relevant question. Now, have you recovered the 70,292? Now, have you recovered the 70,292? Ghana Health Service.
Honorable Chair, the PVs have been fully retired. It's enough.
Chairman, you're a prophet. You're a prophet.
Auditors, have you verified the documents and are you satisfied?
Honorable Chair, they are yet to give us those documents.
All right. Kindly provide the auditors with the documentation to authenticate that.
Yes, sir.
Paragraph 725, Honorable Teddy.
Thank you very much, Mr. Chairman. Mr. Chairman, I want to ask if the amount of 4,150 has been recovered from Mrs. Elizabeth Kwenu for for on-end salary. Thank you very much.
Honorable Chair, the amount has been recovered from her and paid into the account.
Auditors, can you please confirm?
Honorable Chair, confirmed.
Thank you very much, Mr. Chairman.
Paragraph 728, Kwesimentin Government Hospital. On-end salary, 34,949, paid to 2 staff, Dorothy Ama Odro and Dominic Duku. You are to recover the money from them with interest at the prevailing Bank of Ghana rates and paid same into the Auditor General Recovery account at Bank of Ghana, failing which the medical director and the validator should pay the money. Have you recovered the money from them?
Honorable Chair, no, we haven't been able to recover the money. We are unable to reach them, but we've been able to make contact with their next of kins. And we are also in the process of informing Interpol to see if we can track them, because we are not making much progress with the recovery.
And then also inform the IOCO.
Noted, Honorable Chair.
Paragraph 731, unsubstantiated payment, 40,857. So the District Health Directorate, Mpoho, could not provide document to authenticate this transaction. Have they provided the documents?
Honorable Chair, the documents have been provided.
Auditors, have you verified the document?
Honorable Chair, we have an amount of 3,517 that was retired and the rest was supported.
Okay. Paragraph 734, ranking.
an earned salary of 3,715 cedis. Miss Rita Amankwasafo had been validated and paid an earned salary of 3,714 cedis for the month of March 2023. The auditors recommend that the amount should be refunded. Has it been done?
Honorable Chair, the amount has been refunded.
Thank you, Chairman.
Paragraph 736. Vice Chairman.
Thank you very much, Mr. Chairman. We are talking about unearned salary at Peji Polyclinic. Peji.
It's becoming boring.
To the auditors.
Sir, the answer you are giving me is different. This is for Mr. Shaibu Bansi. Now you are talking about a lady.
Bansi and Natu. And Natu is a lady.
Oh, but they have it here, Mr. Shaibu.
Okay, so Natu is a lady anyway.
So, okay, auditors, what do you say about that?
Honorable Chair, the medical report itself, we don't have it. Yes, we were informed he's been ill, and that was the reason why they cannot recover the money. But for the medical report, we don't have it.
Colleagues, when it's 8 o'clock, we'll close and then continue tomorrow. So we have barely 1 hour, 10 minutes more. No.
If I make sure your people went,
The next one is Chito. Chito Health Center, paragraph 738. On earned salary, paid to 2 people, Yvonne Person Anani, Edna Jomina Ajay. Have you recovered the money from them?
Honorable Chair, we recovered the money from them, all the monies.
Auditors, can you confirm?
Honorable Chair, the amount has been fully recovered.
Paragraph 740, Honorable Roxon.
Chairman, thank you very much. Bono Regional Hospital, 7,491 Ghana cedis given out when the person is not supposed to earn it as salary. What's the status? DG, I wish that we'll have a tick so that we'll be taking, especially the instances of unearned salary that has been flagged by the auditors.
Honorable Chair, Amponsa Benedict Amenu has paid, so that has been fully recovered. But that of Felicia Kunedu Yeboah, we haven't been able to recover any of it, and we are still pursuing to recover.
That of finance, this is 2 years, and hers is the greater portion of the amount due. So again, I won't belabor the point, but again, I will emphasize that let's intensify efforts in collection and then streamline measures to so that this doesn't recur. It's too common.
Thank you very much. It's noted.
Did you bring the update on the amount collected with the auditors so that they update their records?
Amponsa Benedicta, we've provided.
Yeah. Okay, auditors, can you confirm that the amount owed by Mr. Amponsa has been recovered?
Yeah, Honorable Chair, for Amponsa, the amount has been fully recovered, but that of Felicia remains outstanding.
Oh, Amponsa is also a lady. I see Benedicta there. Okay, Chairman, Benedicta has paid, but Kunedu hasn't, and that's the status. Thank you very much.
Paragraph 743, Honorable Isaac.
Thank you, Chairman. 743 is also about unearned salaries. And here, 3 separated staff were paid a total amount of 22,688.41 cedis. Have you been able to recover the amount?
Honorable Chair, as Samoa Rosemont, we've been able to recover fully. She has paid everything. But Emmanuel Ansan and Sandra Yeboah Afari, we are yet to recover from them, and we are pursuing to recover.
Auditors, are you aware of the partial recovery?
Yes, Honorable Chair, Asamoah has fully paid. The Emmanuel, Ansa, and Sandra, the amounts standing in their names are still outstanding.
So, Chairman, that's where we are.
Okay. Paragraph 745, Honorable Apak.
Mr. Chairman, not surprisingly, it is the same trend. Payment of unearned salary. Abisim Health Center, Mary Jewa, 8,140. According to the auditors, she abandoned post in November 2022. Yet she has been paid all the way to February 2023. What have you done with regards to recovering the said amount from Ejewa Mary?
Which unfortunately we haven't been able to recover the 8,143.58 from Mary Ejewa.
Is there?
I mean, just as they reported, he abandoned post, and we are finding it.
Mr. Chairman, Ejewa Mary has vamoosed, disappeared, and efforts to trace her have proven futile. I yield to your direction.
So those difficult ones, you have to provide the YOCO with the necessary information for them to track them.
Noted, Honorable Chair.
The next one is paragraph 7. Honorable Kisi.
Thank you, Chairman. This 7 as well for Coraso Healthcare Center. Please, what's the update on this? The amount involved is 8,143 Ghana cedis, 58 pesos.
Honorable Chair, the amount has been fully recovered. In 2 installments, she paid 2,820.24.
Audit Service, can you confirm?
The total amount has been recovered. Thank you.
Paragraph 752. Honorable Aka.
And 752, staff contracted, had overdue advances to the tune of 28,500, and you have recovered 16,552, leaving a balance of 11,948. Like to know if this balance has been fully recovered. Thank you.
Honorable Chair, they have all paid, so the amount has been fully recovered.
All right, auditors, can you please confirm?
Honorable Chair, confirmed.
Let's move on to 755. It's a non-pension contribution, 31,047. The recommendation is to engage a fund manager and pay the money without delay. Have you been able to do so?
Honorable Chair, it's partially implemented. Tier 1 has been fully paid. So 21,973 Ghana cedis, 69 pesos has been paid. And then for the Tier 2, 1,297 Ghana cedis, 45 pesos has been paid. So we still have 7,933 Ghana cedis, 14 pesos of the Tier 2 to be paid or outstanding. And we are going to ensure that by close of next week, the facility settles this money.
And put in place measures to ensure that there shouldn't be any to the fund manager.
Noted, Honorable Chair.
Paragraph 758, Honorable Ajay Boateng.
And this one involves two officers. Afia Chumasi.
Can you apprise us of the position as at now?
Honorable Chair, the feedback we had was that the facility, this particular facility did not receive any such issue in their management letter. So we would engage the auditors to find out which facility this issue relates to and deal with it as such.
Auditors, how come that it was not part of your recommendation?
Honorable Chair, it was part of the issues. We even have a feedback of an amount of 2,689.45 who has been remitted to Senate, but an amount of 996.09 for Tier 2 is still outstanding.
Then I think you liaise with the auditors, whether you have to do reconciliation or something, so that you develop common ground in the interest of the employees.
Noted, Honorable Chair.
So you take it
we'll do that.
yourselves, and then auditors, if it's rectified, then you let us know. Okay.
Well noted, Chairman.
Okay, thank you. Chairman, thank you.
Paragraph 766. Municipal Health Directorate, Esunafonov, Gosu, on self-bond, 28,000. One Miss Ernestina Boateng was granted steadily with pay between 2021 May and 2023 May, but did not return after her studies. So you have to recover the money from her with interest. Have you been able to do so?
Honorable Chair, the full amount has been recovered from the officer.
Auditors, can you confirm?
Honorable Chair, confirmed.
And so you recover with the interest? That's the recommendation of the auditor.
It was recovered without the interest. It's the 28,142.
So go and recover the interest portion.
Noted, Honorable Chair.
Paragraph, auditors.
Yes, the principal has been recovered.
All right. Make sure they recover the interest portion too. Paragraph 769, Honorable Johnson.
Paragraph 14, staff. who were separated from the Gosso Municipal Hospital were validated and paid a total salary amount of 246,738.34 Ghana cedis. Municipal soup were detailed to recover this amount, or else you pay. Please, has the money been recovered?
Honorable Chair, 44,725 Ghana cedis, 26 pesos have been recovered. So we still have 201,900.
We'll look at it. But I just wanted to say that our finding is that the brain drain has exposed some of the weaknesses in the validation process. And that we will work towards that those who go to school, how we track them, because they go and they disappear, and you're waiting for them to finish, and before you know, they are gone. And so we need to put in new mechanisms to ensure that our validation systems are in place. Some of our hospitals are big. There's one validation center. It's very difficult for one person to do the validation. So we are putting in a system to ensure that there are units where people will provide reports before validations are done. So we're taking some lessons from here to see how we can fix the system better.
But for Charles, he definitely might be outside the country, so the Yoko should also be notified about him, so that he can also be tracked. Yes.
Chairman, I would plead with Director General. Sometimes the students can almost work and go to school, except for the fact that we're not flexible with their schedules. So I think we should look at that from a policy standpoint, where we are flexible with them so that they can do both the school and be working.
Thank you, Chair. Actually, we're also initiating a process of reviewing that, so that instead of people just taking, we can still allow them to be more flexible in working in education. So we are actually looking at that approach, because it also prevents people from going to school, because we can't afford for them to go away for 2 years. So it's something we are looking at.
Auditors.
Yes, Chairman, for Charles Asio Buedum Senior, he has made some payment, about 15,000. So the 44,725, he has made 15,000 out of it.
All right, so that's an information for you. Paragraph 772, Boma Government Hospital. On earned salary, 122,964. So one Richard Ohinijan was, who vacated post since November 2017. He was, however, validated and paid total amount of 122,963.76. The recommendation is that medical soup should recover this amount with interest from Mr. Richard Ohinijan. He vacated posts, but he was still validated. Have you recovered the money from him?
Honorable Chair, unfortunately, the money has not been recovered. But this officer, from the information we have, he is in the country. So he was reported to police, arrested, granted bail, and is currently being arraigned before court. That is Richard Ohinijan. So that's the update we have on him.
Auditors, are you aware of this?
Honorable Chair, we are not aware.
When is it going to be sent to court? Because it's been arranged for court, so when?
Honorable Chair, we will obtain an update on that and update the office auditors.
Paragraph 774, Bechem Government Hospital. On earned salary, 17,606. This was paid to two officers, Grace Jima and Alfreda Asantiwa Nyamiche. They vacated posts, but they were validated and paid this amount. You have to recover the money from them, have you?
Honorable Chair, Grace Jima has fully paid the money standing in. She paid 3,000 and then another 10,586, so 2 installments. But for Miss Alfreda Santua Nyamiche, the record showed that she was not paid for the month of June 2023. So for her, there's no on-hand salary in her name.
Okay. Auditors, can you confirm that of Grace and also confirm Alfreda Nyamiche?
Yeah, Honorable Chair, we can confirm that Grace Jima has fully redeemed herself, and that of Asantewa Nyamiche did not receive the salary.
Okay. The next one, paragraph 778, Achirensua Health Center. On earned salary. Again, one Emmanuel Entry, senior staff nurse, applied for his annual leave. Subsequently, applied for 1 year leave without pay. However, he was validated and paid a total 6,145. You have to recover the money from him. Have you recovered the money?
We've recovered 4,800. So there's a balance of 1,345, which is still under recovery.
Auditors, can you confirm?
Honorable Chair, confirm.
All right. Paragraph 781, Kenya Sea Government Hospital, with health taxes not remitted, 9,993. Have you remitted same?
Honorable Chair, all the amount has been remitted.
Auditors, can you confirm?
Honorable Chair, confirm.
Paragraph 784, Kenya Sea. Again, that's Kenya Sea Government Hospital. Unsupported payment, 13,960. You have to recover the money from the accountants. Have you?
Honorable Chair, all the supporting documents have been gathered and made available.
So you have not recovered the money, but you accounted for the use of the money.
Honorable Chair, yes.
Auditors, can you confirm?
Honorable Chair, the money was not recovered, but they were able to provide relevant documents to support the expenditure.
Okay. Paragraph 787, Honorable Jifa.
Chairman, there's been a vacation of post by Anite Free Anoche, Godfrey Urenchi Kumi, Amwa Mubashir, and Obin Lorinda Boatma. They altogether received 25,553 as an earned salary. The recommendation is that the Municipal Health Director recover same, and I would like to know whether it has been done.
Honorable Chair, the amount has been fully recovered from the officers.
Chair, I want to know if there were any sanctions for the person who authorized the payments. when the individuals had vacated post.
Honorable Chair, we are here to confirm that from the region. So we would confirm that with the auditors.
Chair, this happened between June 2022 to May 2023. Almost a year. How did that happen that they could earn salary when they were not at post for that long?
Yeah, Honorable, if you take it on individual basis, the first one is June to July 2022. That's 2 months. The second one is only August 2022. The third one, February to April 2023. That's 3 months. And then the last one, February to May 2023, 4 months. So that's the period.
Thank you for your leadership, Chairman. Thank you. Chairman, I yield.
Yeah, so where are the validators? If we can't find these people, we will require that the validators look for them or refund the money.
Honorable Chair,
They are paid.
They paid, yeah.
Okay, that's fine. Let's go to paragraph 790. Abuasi Health Center. Wrong placement on salary scale, 8,241. One Ruth Ousu Boatin was wrongly placed as a staff midwife, a grade which was higher than her actual rank and level. So you have to recover the money from her, have you?
Honorable Chair, an amount of 5,499 Ghana cedis, 88 pesos has been recovered from her. 2,740 Ghana cedis, 89 pesos is still under recovery. We have also since changed her grade to senior enrolled nurse.
Auditors, can you confirm the recovery?
Honorable Chair, confirmed.
All right. Paragraph 793, 30.
Thank you very much, Mr. Chairman. Mr. Chairman, I would want to know if the amount of 23,932.50 cedi has been recovered from Mr. Quatin for unearned salary.
Honorable Chair, it's not recovered. But the management of the facility, from our follow-ups with them, they indicated that they disagree with the auditor's observation because the officer was at post. And they had...
Mr. Chairman, I yield to you.
All right. Auditors, they have disagreed with you. Have you done the reconciliation to know that he was at post?
Honorable Chair, they are just saying it here today. We don't have any evidence to that effect.
So provide the auditors with the evidence you have that proves that he was actually at post.
Honorable Chair will do that. It will be done at the district.
The district level, yes. All right. Paragraph 9798. Ahmadiyya Muslim Hospital, Kokofu. On earned salary, 151,506 cedis, which was paid to one Dr. Yao Anoche Asiedu. This was This amount was paid to him when he was pursuing a 3-year program in child health at the Ghana College of Physicians and Surgeons. They noted that management validated.
Honorable Chair, respectfully, is Chag.
For this Chag.
Ahmadiyya. Ahmadiyya. Okay.
This Ahmadiyya.
They are not under.
Are there with Kokofu, that is Chag. So we are dealing with Ahmadiyya Muslim Hospital.
They are not under Ghana Health Service.
But they are under what?
Just like Chag are the Christian, they also have the Muslim group.
Muslim group different from Chag.
Mission Hospital says.
Different from Chag.
Yeah, different from Chag.
Hey. I'm not aware of this.
Chair, it's called the Ahmadiyya Mission.
Ahmadiyya Mission. Clerks, take note and start inviting Ahmadiyya people. So we can't take this one, or you cannot answer this. All right, so I'll flag it. Then let's go to paragraph 803, ranking.
Thank you, Chairman. Failure to return to post after study leave with pay. The amount involved is 61,898 cedis. MS Angelina Afriye Owusu was given study leave. He completed and should have reported to work on the 6th of May 2021. He didn't do that up to the 10th of May 2023. And the recommendation is that the amount of 61,898 cedis should be refunded by Miss MS Angelina Afriye Owusu. Has it been done?
Honorable Chair, unfortunately, we haven't been able to recover any amount from Miss Angelina Afriye Owusu.
Okay. Chairman, you can take over.
Thank you very much, sir. The next infraction is on paragraph 808, and it's on earned salaries. 222,000 cedis, 975 Ghana cedis. And you are to retrieve these amounts, to recover these amounts from Rebecca Boahene and Prince Edu. What is the status of this amount? Is that if you do asking?
Yeah. Honorable Chair. So 2,000 Ghana cedis has been recovered from Rebecca Boahe. She still has 90,234 Ghana cedis, 63 pesos to pay to government. For Prince Edu, no recovery has been made at all.
The auditors have recommended that the validators should pay. I think I'll ask that Chairman, we affirm that recommendation. It's about time we ask the validators to pay, because that is the main cause of the problem. Thank you, Chairman.
And may I suggest that next time, those validators who created this mess, you bring them here. You let them sit down from 8 o'clock or 9 o'clock to midnight so that they see what you go through. Did you create any of these problems? No. But look at you here. Bring those people who committed these infractions. Huh? Oh, there'll be next time. Health Service.
Mr. Chairman, yeah, I am so happy about your comment. I'm so happy about your comment, and I associate myself with that. And this is the point I was trying to make earlier on. That at times we blame, for procedural purposes, we blame the head of the institutions, or even the Director General. They are here answering all this. The people who committed these things, and I agree with you. But as a committee, we should find a way of bringing those people here to answer.
So, only 2,000. So, what are we doing on it?
Honorable Chair, we'll report them to IOCO for them to assist us to retrieve these monies for government.
All right. The next infraction is on paragraph 810, unaccounted revenue of 53,670. And what has happened to this amount?
Honorable Chair, the full amount of 53,670 has been recovered.
Can the auditors confirm, please?
Honorable Chair, confirmed.
Okay.
Also taking disciplinary action against the officer.
You took disciplinary action.
We changed his job schedule from collecting revenue to working on insurance claims. So he doesn't come into contact with money.
I won't comment on the punishment, but I have worked at places that when you commit infractions like this, you are fired. But what happens is, you can't fire anybody, you just transfer them and you demote them. One day they will grow up and then they will do it again. Paragraph 815, vacation of post after steady leave with pay, 94,696. That is Yenahini Hospital. And the guy is Nicholas Mason O2. What has happened to this amount?
Honorable Chair, we entered into a payment plan arrangement with the officer. He's paid 30,000 Ghana cedis. So we still have an outstanding amount of 64,695 Ghana cedis, 93 pesos, still under recovery.
Auditors, can you confirm that, please?
Honorable Chair, an amount of 30,000 has since been paid, leaving a balance of 64,696.
The next infraction is on paragraph 819. Honorable Isaac, please.
Thank you, Chairman. Chairman, this one is about offense of Municipal Health Directorate offense. Chairman, one Miss Mavis Chemenu Sasa vacated post and was still validated and paid 2,610.66 Ghana cedis. Has this amount been recovered?
Honorable Chair, our checks indicate that she was not paid for the month of January 2023. And a printout of the ESPV actually proves this.
Cannot the auditors confirm?
Honorable Chair, we can confirm that the officer didn't receive the money.
Chairman, I had prepared to come and pay this money in case it hadn't been covered, but
Honorable MP, pay the other amount.
no, it's been rectified.
It's been rectified.
Yes.
All right.
So, Chairman, we are good to go.
The next infractions on paragraph 821, unserved bond term, 270,988. That's for 3 people. What have we done about that?
Honorable Chair, unfortunately, again, no recoveries have been made. In the case of these three officers, I want to mention their name again. Darocha and Kuma Boatin, Michael Obin Menu and Michael Kwabanaba. We are looking for them, but we would report them to Yoko to assist us to recover these monies.
It's very important you report them to Yoko. I'm sure their families or friends might be listening to us. And if they are not in the country, they should inform them that we are reporting them to Yoko. And they'll be fished out. Paragraph 825, Honorable Ennis.
Thank you, Mr. Chairman. So this infraction has to do with unearned salary again of 20,003 Ghana cedis. The auditors recommended that the medical soup recovers this amount from Ms. Nerita Akowa. What is the update on this?
Unfortunately, we haven't been able to make any recovery from Ms. Nerita Akowa.
But what steps have you taken? Have you written to her or have you tried to contact her?
We've not been able to locate her. It's difficult locating her. So from the direction we have got from Mr. Chair, Honorable Chair, we would report to Yoko to assist us.
Thank you, Mr. Chairman.
Paragraph 830, Honorable Kofi Adams.
Thank you very much. Paragraph 830 for ANOSAF, East District Health Directorate, Edujamai, and Anima Edusi Poku applied for steady leave without pay, but she got paid for September 2023, and the auditors say the 4,839 Ghana cedi 26 pesos be retrieved with interest. Have you done so?
Honorable Chair, the full amount has been recovered from the officer. So he paid 1,933 Ghana cedis and also made another payment of 2,116 Ghana cedis, 34 pesos. The difference is the tax component. That is 789 Ghana cedis, 66 pesos.
You were to do so with interest. Why didn't you add the interest?
Honorable Chair, we will pursue the officer to get the interest.
Auditors, can you confirm the collection of the principal?
Honorable Chair, we can confirm the collection of the principal. Thank you.
Chairman, principal collected, interest yet to be pursued. We can proceed.
Thank you. Paragraph 832, unremitted withheld taxes. 3,200.
They remitted 2,900 Ghana cedis, 60 pesos, and then the 299 Ghana cedis, 40 pesos was remitted on Monday. That was yesterday.
Okay, auditors, can you confirm?
Honorable Chair, confirm.
Okay, paragraph 835. Also, withheld taxes not remitted, 4,619. Has it been done?
Honorable Chair, it has been fully remitted.
Auditors, can you confirm?
Honorable Chair, confirmed.
Paragraph 838, Honorable Ajay Boatin.
Thank you, Chairman. This is rejected NHIS claims, and they were rejected on account of the fact that the submissions related to inappropriate prescriptions, oversupply of medicines, and overprescription of drugs. So there's the table there that shows the total amount claimed and the rejected amounts. The recommendation is that the municipal health director should identify the staff whose negligence caused the loss of the 89,000 208.11. And the same recovered from them and paid to the Auditor General's recoveries account. What's the situation now?
Honorable Chair, this was actually a structural problem, which had to do with the claims management system that was in use at the time. But as my boss, the Director General said, now they are using the Claimit. They are also using the electronic records management system. So when they process the bills, if there are mistakes, the system would automatically reject it. Besides, when we got to know of these structural issues, which included a dysfunctional claims vetting system, they now have a claims vetting committee, which is very functional, and they vet all the claims. They've been trained. So this situation has been dealt with and is under control.
No, but this one was after the event. But what happened? The recommendation was to the effect that you should take certain steps, certain actions. Some of those actions was to identify those who were negligent in that and ask them to pay.
Honorable, we had a similar encounter earlier on. And because it was attributed to the structural challenge, it's going to be a responsibility of the entire hospital not to give the fault to an officer, because it's a structural problem, not their fault, because of the system not being available to detect and to do that. So we agree that we assume that those rejected ones are lost to the hospital and we should write it off. Paragraph 841, overpayment to suppliers, 11,440. So the hospital, that's Municipal Hospital Ejura, overpaid this amount to suppliers. And you have to recover the money from the suppliers. Have you been able to do so?
Honorable Chair, there was no overpayment.
Okay.
At the time of the audit, some of the SRAs were misfiled and couldn't be immediately traced. But those SRAs have since been retrieved and submitted. We have SRA number 0045504, SRA number 005513303, 304, 302, SRA number 00144116. So these items were supplied.
Auditors, can you confirm that the reconciliation was done?
Honorable Chair, no reconciliation has done, and we still stand by our recommendation. Thank you.
All right. They claim they have SRA numbers that prove that those items were received. So you have to ask your staff in the district to go and do the verification.
Well noted, Chairman.
Paragraph 844, Honorable Amokwata.
It's in respect of Mampong Government Hospital. Mampong Government Hospital. The auditors found out that 67 occupants of the hospital's quarters defaulted in the payment of rent to the tune of 78,108 cedis for the period between 2021 to December 2022. And the table provides the list of the occupants who defaulted and the respective amount. What is the position now?
Honorable Chair, only 12,250 out of the money has been recovered. So we still have 65,930 to be recovered. But what we are doing is that we want to mechanize even these outstandings so that it will be taken from their salaries.
Yeah,
So that is what we are in the process of doing.
But can you assure us that all these people are still at post?
Honorable Chair, the feedback we have is that they are all at post.
Okay. I think that you should adopt measures that would enable them settle this amount once they are at post and working, so that you provide the auditors with the progress that you are making.
Noted, Honorable Chair.
You should speed up with the process to mechanize them so that you don't continue to accumulate the rents. Once you work
Noted.
on how to recover the arrears.
Noted, sir.
Auditors, about 12,000 have been recovered. Can you confirm that?
Honorable Chair, we have 4,300.
Hey.
Honorable Chair, we will reconcile that with them. We have document receipts to show
All right.
12,000.
Okay. Paragraph 847, Konongo Odumasi Government Hospital. What did I say? How do you pronounce it? What did I say? Is that Oh, I said Konongo. 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 But you should praise me. I can pronounce the Akan names very well. You cannot pronounce my name. Oh. If I say pronounce Agbolosu, can you pronounce it? You see now? Okay. So on earned salary, 148,717, paid to 11 staff. These people were validated by the hospital and they received this money, even though they vacated posts. And some of them are for 1 month, some from May to October 2022, September to October 2022, and November 2022 to February 2023. So the figures vary. You have to recover the money from these 11 staff or former staff. Have you?
Honorable Chair, unfortunately, we haven't been able to recover from any of them so far. They are not at post.
Yeah, they have vacated posts.
Yeah, they have
so
vacated
you have to
posts.
look for them and retrieve the money, or they are guarantors.
We'll do that, and we will also solicit the assistance of Iyoko
Yes.
for that.
It's unfortunate, nothing has been recovered. 148,000. Paragraph 849, Honorable Johnson.
Thank you, Chairman. New Dubiase Government Hospital. Unserved bond term and unearned salary totaling 357,234 Ghana cedis in relation to Dr. Leslie Kojote, a senior medical officer who was granted a study leave with pay and failed to return upon completion of his study. Yes. Medical director was supposed to recoup or recover this amount. Please, has the money been recovered from Dr. Tay?
Honorable Chair, unfortunately, Dr. Leslie Kojote, nothing has been recovered from him so far. And we would solicit the assistance of IYOCO to be able to retrieve these monies for government.
Why all this while until now you want to solicit for? Please, I'm waiting.
So it was like he will be coming back. If you look at the report, it was like he will be coming back, and then finally it was realized that he's not going to come at all. And that is why there's been a little delay, which is unfortunate.
Who is his guarantors? Captured here, guarantors, who are they?
We don't have that information immediately, but we can provide that when we contact the
You
facility.
look for the guarantors for them to refund this money. Thank you, Chairman.
In addition to demanding the money from the guarantors, again, you have to also report this to the IYOCO so that they can also help to trace him. Paragraph 855, Municipal Health Directorate, Obuasi. Payment not fully accounted for, 5,620. Have you refunded the money or accounted for it?
Honorable Chair, we have fully accounted for the money.
Auditors.
Honorable Chair, they've accounted for it.
Paragraph 857, District Health Directorate, Adansi Akrofom. On earned salaries, 44,153. Paid to T3 staff, Apana Jacob Sunday, Eric Jackson, and Patience Money. You are to recover the money from them. Have you been able to do so?
Honorable Chair, unfortunately, we haven't been able to recover anything from Mr. Apana Jacob Sunday, Eric Jackson, and Patience Main. We haven't been able to, but we would engage IYOCO to assist us to recover these monies for government.
The management of the hospital are actually not taking any action. When these were discovered by the auditors, cited in the management letter, before the committee EV begin to sit, some action should be taken, but they haven't done anything.
Honorable Chair, we agree with you. And for us, some of these issues come to us quite late, especially when the report is published. So what we want to do is to engage the Auditor General so that at least the regional directors will get copies of these management letters so that we can be more proactive in dealing with them.
But if the management letters are given out to the facilities, can the regional director demand from the facilities rather than going to the auditors? Because you'd have known if it's coming from the facility themselves. Because if you take it from the auditor, the facility can later say that we don't have that, by demanding from them that what are your management letters, so that the regional directors will know the issues in all the facilities under his jurisdiction.
Chair, we can do both, but they being copied will be easier because the audits are done at different times in all the facilities. So if they issue the report and they copy the regional director, that way the regional director can easily get it and promptly too, so that it's well coordinated. Because the way some of these facilities take the audit, the seriousness they attach to it is not so much as compared to higher authority.
Okay, let's look at how practicable it can work. The team issued the management letter and copied the regional director. Is the team going to post to the regional director, or it will be given to the facility to be given to the regional director?
Honorable Chair, in almost all cases, the regional audit service is in the regional capital where the regional health directorate is also located.
So easy to give them copies. Okay, that's fine. So auditors, take note of that. It's a request that you can look if it is possible. That anytime you issue management letter to any facility, a health facility, copies should be given to the regional director of health services.
Chairman, why shouldn't we put the burden on their own officials that when they get a copy of the management letter, they need to inform you on it?
Chair, maybe for the sake of those who may want to hide things, that's why I'm asking for both directions. We will demand.
All right, paragraph 859. Again, on earned salary. This was paid to one Shaku Said. $115,908. 10,000 have been recovered, leaving a balance of 105,908 Ghana cedis. You have to recover the money from Said. Have you recovered the money? This is a Kumasi South Hospital.
Honorable Chair, 35,000 Ghana cedis has been recovered so far. The rest is still under recovery from the officer. And there's an agreement with his guarantor to pay the rest. So 35,000 has been recovered.
Auditors, can you confirm recovery of 35,000?
Honorable Chair, we can confirm a recovery of 35,000.
Do you have a payment plan with the
Guarantor,
officer?
yes. We have a payment plan with the guarantor.
So by what time will he finish paying the balance?
Honorable Chair, he's paying 5,000 Ghana cedis every month.
Okay.
So, yeah.
So let's say by 14 months, he should be able to finish.
It should be done, yeah.
All right, paragraph 862, Honorable Aziz.
Thank you, Chairman. Uncollected rent.
Honorable Chair, I think it's Konfanochi Teaching Hospital, respectfully.
Yes. Yes, it's
So,
Konfanochi.
so that is under the ministry.
Yes, sir.
And so the ministry is listening. Director PPMU will respond.
Okay. You have uncollected rent. That is to a tune of 358,136 Ghana cedis. Are you able to collect this rent?
Thank you very much.
I'm tired.
Unfortunately, Konkwanochi is not here right now, so we are reliably informed that management has written to the banks to demand payment for the amount owing and subsequent periods following. Cal Bank in January 2024 paid a total of 28,453 cedis.
Okay.
And we have attached a copy of the check that was received and letters issued to the bank also. Management is, however, still pursuing the bank to collect all the outstanding amounts.
Have you made these documents available to the auditors?
Yes, those we have made available.
Auditors, can you verify this information?
And they have further deducted an amount of 566,000 from staff occupying the Cath bungalows who are still owing.
Okay.
Yes.
And all these are available to the auditors?
Yes, the schedules were attached, but I don't know if it was transmitted same because that was the information we got at the ministry.
Please, auditors, can you verify?
Please, we don't have any documents to that effect.
Chair, please, we can make it available by tomorrow to them.
By tomorrow, Chairman.
Thank you.
They said by tomorrow.
All right.
Chairman,
It's exactly 8 p.m. by my watch. I promise I will close at 8 p.m., but looking at the number of issues remain, I think we can use some 20 more minutes to finish it so that we don't worry the ministry to come back tomorrow because of this few things. I think you agree with me. Yes.
Mr. Chairman, she says she's bringing some document tomorrow.
But that one, she can just send somebody to deliver it.
Oh, okay.
All right, so let's go to paragraph 868, unrecovered staff advances, 50,459. About 12 staff involved who have been given advances totaling this amount. Have you recovered the amount from them?
Thank you very much. Indeed, here also, there are some further actions required. Management actually has taken steps to recover 12,000 out of a total of the 50,000, and is still following through to recover the remaining 38,000 approximately. So there are details here of the outstanding balances. For Mildred Educhumuapia, 128.79. For Giorgio Forianin, 3,000 is
Okay,
outstanding.
that's fine. That's fine.
Okay.
Auditors, can you confirm the recovery of 12,000?
Those documents are yet to be made available to us.
So, add it to what you are bringing tomorrow.
Yes, Chair. Thank you.
The next one, paragraph 872, Honorable Jifa.
Thank you, Chairman. The unfortunate incident of unearned salaries has reared its head again. Eugenia Kwesiwa Crime, Evalak Asante, Estancia, Denzel Ajay, Sandy Elijah Ousu, Bisabak Gordon Kati, Poma Agatha Mensa, Jemfa Francisca Ajiman, Victoria Sam, Duya Buachi Ajiman, upon Samuel Chechiku, Ousu Ajiman. These 12 people have received salaries amounting to a total of 76,877. The auditors have recommended that the Chief Executive Officer recover same. Failing that, the CEO is supposed to deal with this, and I would like to know if you've made any progress so far.
Thank you very much, Chair. Yes, a lot of progress, but it still requires some further action. Management, upon receipt of the observation by the audit service, took steps to re-examine the personal records of the staff in question. They noted that the official letters were issued by management to the appropriate authority. to stop the payment of the salary of the affected staff. They further informed the financial institutions where these staff receive their salaries to return such unearned salaries to government chest as required by the Public Financial Management Regulation 2019. So, you know, there are also copies of letters to that effect. Management also took steps to freeze the affected staff Provident Fund contribution balances available, and such funds shall be used to defray the unearned salary as is due. Thank you, Chair.
Chair, this spans the period of between 2021 to 2023, and we are in July of 2024. So are you able to give us exactly what has been recovered and what's outstanding?
Chair, please, it will be difficult right now, but we can still make that exact amount available by tomorrow. Thank you, Chair.
Chair, I yield to you.
All right, made it available tomorrow. Confanoche, paragraph 874, Honorable Frida.
Thank you, Honorable Chair. 874 is in relation to rejected NHIS claims. The auditors noted that between January 2022 and February 2023, the Confanoche Teaching Hospital submitted claims totaling 42,084,655.97 to NHIA, but was refunded only 41,290,721.79, leaving a difference of 793,934.18. It was rejected due to one, non-compliance with NHI's guidelines by the hospitals. Reasons assigned for the rejection include inappropriate prescriptions, over-prescriptions, inactive member numbers, overbilling drugs, diagnosis mismatch, duplication of drugs, unclear diagnosis, and age treatment mismatch. Mr. Chairman, between July 2021 and January 2023, the Confanoche Polyclinic also submitted claims totaling 1,594,263.96 to NHIA, but was refunded only 1,299,651.11 pesos, leaving an amount of 294,612.85. It was rejected due to non-compliance with NHIS guidelines by the Polytechnic, and reasons assigned for the rejection include inappropriate prescriptions as usual, over-prescriptions, inactive member number, overbilling drugs, diagnosis mismatch, and they've given us the details. The auditors recommended that the Chief Executive Officer should identify staff whose negligence caused the loss of 1,088,547.03 to the hospital and recover the amount from them, and same paid into the Auditor General's recoveries account. They also recommended that the Chief Executive Officer should improve the internal control mechanisms to avoid rejection of claims in future. Mr. Chairman, there's no response from management to the recommendations, so I want to find out from them whether they have complied with the two recommendations from the Auditor General's Department. Thank you.
Thank you very much, Chair. According to the report we have, the NHI deducted the amount without doing any reconciliation with the teaching hospital itself. So it suggested that there was actually a problem between the two institutions. So management, Confanoche management has requested, they further requested for the reconciliation to be done, but they were not given the chance to do exactly that. So Confanoche says they would continue to pursue the issue with NHIS and do the reconciliation before they are able to zoom into the amounts. Equally, management has taken steps to look into the subsequent submissions to NHIA to avoid the repetition of such occurrences. I submit, Chair.
Thank you, Mr. Chairman. So are you in effect telling us that the figures given by the Auditor Generals and that of the NHI, you need to do some reconciliation, but have you informed the Auditor Generals, the auditors about it?
Yes, yes, we admit that some reconciliation can be done before it is settled, but because the matter is still pending, we haven't been able to do that. It's difficult to give any reasonable evidence to the auditors, and therefore it shall be carried out. Thank you, Chair.
So, Chairman, I want to find out from the auditors if they are aware of this issue of reconciliation and the discrepancies that has evolved.
Honorable Chair, we are waiting for our response, which we have not received. So the recommendation still stands. Thank you.
Chairman, I'm not too clear with the explanation from the ministry, but I think that if you give them some time to link up with NHIA to do the reconciliation and you'll get back to the committee. But my last question is, apart from that, you didn't even respond to the auditor's recommendations. So I want to find out, have you put any control measures in place to forestall any future occurrence?
Okay, so Konfanochi reported that the management itself has put a little committee in place to be looking into such subsequent claims, because that is where the problem is their word against probably the NHIA. So now they need to zoom into such requests and be able to iron things out very well so that they are not slapped with amounts that are not, they cannot speak to. So that is what they have done as at now, to forestall future occurrences and also to look into the original one, what has actually happened, before they can conclude that they are very indebted as per the audit infraction. Thank you.
So, Mr. Chairman, my last question. So are you in effect telling this committee that...
How many last questions do you have?
Chairman, this is the last one. Chairman, I'll send it to you. Thank you.
I said you can go ahead and ask your last of last.
Yeah, Chairman, I just wanted to find out from him, that, from her, she's telling us that the reasons given by NHIA, which includes inappropriate prescriptions, over prescriptions, inactive member numbers, over billing drugs, diagnosis, whatever, are not true, or because you think that you need to do some reconciliation, these things do not happen? Because practically, I know it happens. Because even if you submit your NHIA claim, they'll still have to go through a process to ensure that you are being paid the correct amount. So all these things happen practically.
Okay, so before they can actually conclude, these are very contestable issues. So when NHIA finds those things or declines in a way, management ought to sit to adjust, reconcile the accounts, see where the prescriptions are, see where the real problems are, and conclude. But they were not given the chance to do that before it was captured as an audit query. So that is exactly what the management has set up a team to do going henceforth, and also to look into this particular infractions as per the wrong billings, the prescriptions and the mismatches and all that. Thank you, Chair.
Thank you very much, Mr. Chairman. I yield to you, but I think that we should give them some timelines to provide us with further information on the reconciliation with the NHIA and the auditors. Thank you.
All right, thank you, Honorable. So you have to do the reconciliation. I think this reconciliation can be done within a week, maximum 2 weeks, so that we'll establish the actual amount involved and inform the auditors.
Thank you very much, Chair.
So we are back to Ghana Health Service. We have some few ones. I'm sure it's about 9 infractions. Paragraph 884 which is Gonja East Municipal Health Directorate, Salaga, on earned salary. This was paid to one Mr. Owusu Mensah Saki, total of 125,072 Ghana cedis. He was granted, he applied for study leave with pay, which was not approved by the Director General. The auditors noted that he proceeded on leave and was validated and paid this amount. You are to recover the money from him, have you?
Honorable Chair, unfortunately, we haven't been able to recover the money from him. That's Mr. Owusu Mensah Saki.
Yes.
Yes, we haven't been able to recover the money from him. We wrote to his bankers to try to get whatever is in his account, but that was not successful. The bankers were not cooperative. And after a lot of pursuing him unsuccessfully, in July, 21st June this year, we wrote to IOCO to assist us to retrieve these monies. So we would follow up with IOCO to ensure that they assist us to retrieve the money. But that's the status.
But what is surprising is that the study leave with pay was not granted. So why should the validator continue to validate him from September 2018 to January 2023? Where is the validator? Why did he continue to validate him for all this period? There must be some collusion. So we are recommending, clerk, take note, we are recommending that the validator in this case should refund the money and we'll pursue the recovery from the Mr. Owusu Mensah Saki. What is the name of the validator?
Chair, we can find out the exact name and.
Yeah, but the directive is that the validator should be made to refund this money.
So, Chair, well noted.
Paragraph 886, ranking.
Withholding tax of 6,391 cedis has not been transmitted. Has it been done now?
Honorable Chair, 5,000 of this has been paid, leaving a balance of 1,391 Ghana cedis, 25 pesos. And we will get them to pay this money before the end of this week. I don't know why. It's a small amount of money, so we'll get a facility to pay.
Thank you, Chairman. I'm done. Auditor, sorry, can you confirm whether that money has been paid?
Honorable Chair, the full amount has been paid.
Full amount?
Yes.
Okay. Director, thank you.
All right.
Okay, so we'll update our records.
Paragraph 890, Vice Chairman.
Thank you very much, Mr. Chairman. Now you have a children's ward facility not in use. What is the status of it right now?
Honorable Chair, it is still not in use.
Why not? You spent close to 140,000 Ghana cedis to build it.
Chair, it was put up by the Assembly. It's actually not completed. It's not finished. And the roof is still leaking. So we are waiting for those fixes to be done before we can make use of them. And as at this week, it's still not completed yet. It's not finished for us to be used.
I'm just curious. Ghana Health Service and the ministry, do you guys have internal auditors?
Yes, we do.
And you pay them to work?
Yes, sir. Yes.
And it takes the chief director and you to come, and the internal auditors are somewhere else?
They are here.
They are here. Then they should be answering some of these questions. Why are you allowing these things to happen? And you are not informing the big guys about it. You need to be telling the big guys what is happening. But here you are quiet. Internal auditors, have you guys seen audit reports from the Auditor General?
Chairman, good evening. Yes.
Anyway, you don't need to answer.
Mr. Frimpong, you're welcome.
Thank you, Chairman.
He took the oath in the morning. I saw him. So, paragraph 895, Chiriponi District Hospital, unremitted Tier 1 contribution to SNID, 14,342. Has it been remitted?
Honorable Chair, the full amount has been remitted.
Auditor, confirmation.
Honorable Chair, confirmed.
Paragraph 899, failure to remit income tax, that is pay as you earn, to GRA, 2,606. Has it been remitted?
Honorable Chair, the full amount has been remitted.
Auditors, confirm.
Confirm, Honorable Chair.
Paragraph 904, Honorable Isaac.
Thank you, Chairman. 905, misappropriation of SNIT contributions. You withdrew an amount of 5,455 of casual staff contribution, and this was not remitted to SNIT. Have you been able to do so now?
Honorable Chair, we have retrieved the monies from the casual staff. 3,389 Ghana cedis has been remitted to SNIT. With the Tier 2, they have issues with the registration, so that money is in the account. Once they are done with the registration and the account code, they'll pay that one as well. But the money has been fully retrieved from the officer, and he's been fired because he's a casual staff.
The officer is a casual staff himself.
Honorable Chair, yes.
Oh. Auditors, can you confirm the recovery and the amount remitted to SNIT?
Honorable Chair, we can confirm the recovery, but for the firing of the officer, we are not aware. Thank you.
But the said amount has been remitted to SNIT. Can you confirm that as well?
Yes, Honorable Chair.
All right, Chairman.
Thank you. Paragraph 907, Honorable Park.
Very well, Chairman. Kologo Health Center. No, this is Kologo. Kologo. Not Konongo. Kologo. This is the one that Chairman should be pronouncing. Kologo. Unaccounted payments. That they noted that a total amount of 11,371 Ghana cedis, 22 pesos disbursed on 15 paid vouchers for various activities and supplies were without relevant supporting documents. Have you been able to find the supporting documents and presented them to the auditors?
Honorable Chair, we've done that. The supporting documents have been retrieved and submitted.
Auditors, can you please confirm?
All the necessary documents have been provided.
Kologo is home and dry.
Thank you very much. The penultimate question or infraction, paragraph 910, NS.
Thank you, Mr. Chairman. Completed projects not in use. The auditors noted that 2 projects funded from the MP's Health Fund at a cost of 245,994.88 were completed back in December 2022, but were not in use by the Bolgatanga Municipal Health Directorate. What is the updates on these two projects now?
Honorable Chair, the two projects are now in use.
Auditors, can you confirm?
Honorable Chair, they are using the projects now.
Thank you, Mr. Chairman.
Paragraph 914, Honorable Kofi Adams.
Chairman, when you say the final question, I thought, so I closed my book. Penultimate, so I closed my book. But, well, unremitted tier 2 contributions amounting to 6,241, involving some of your staff. The directive was for you, the medical superintendent, to engage a fund manager so he could remit the tier 2 contribution without delay. And if there is any sanction, the medical superintendent and the accountant should be personally held responsible. Has the transfer been done to the tier 2 fund manager?
Honorable Chair, we have been able to engage the tier 2 fund manager that as recommended. So the facility has been registered. The staff have also been registered with the enterprise trustee, but they are in the process of creating the account code so they can pay the money in. So that's where we are. And immediately they are done with the creation of the account code, the monies will be paid.
Is there any indication of any charges or sanctions for the delay?
Honorable Chair, there is no indication to the best of our knowledge for now.
So any indication, you must hold the medical superintendent and the accountant liable for that, and not the poor working staff whose contribution was further delayed.
Well
Auditors,
noted,
do you have
Honorable
any
Chair.
information on the progress so far?
Honorable Chair, they have informed us about what they have done so far.
So follow up and make sure they do it. Mr. Chairman, we can move on to the next one. If it's not the final one.
That was the last one. So we have come to the end. Those outstanding issues that need further action, let's work on them. We need the feedback through the auditors to help the committee to write our reports. But I want to thank you very much, the Deputy Minister, the Director PPME, the Director General, the Financial Controller, or Director of Finance, and all other directors who came since morning and been here up to this time. I want to thank you very much. And thank the members of the committee, even though you've been going up and down. Some of us have been here since we started. So I thank you very much. Tomorrow, we are expecting to meet at 9:30. We are expecting to meet a number of ministries, I think about 4, including Ministry of the Interior. They'll be here tomorrow. So let's be on time. And the issues tomorrow are not busy, many, so it will be a bit lighter. Probably before lunchtime we'll have closed. So I thank you very much. Ministry of Health, Ghana Health Service, you are discharged.
Thank you, Madam.
Thank you, Chair.
Thank you, Mr. Chair. We are very grateful for your time and everything. And she will bring the rest of the document tomorrow.
Okay.
Thank you very much.
Thank you very much.
And
the
have
meeting
a
is
safe
adjourned to tomorrow at
home.
9:30 in the forenoon.